go. What's up? What's up? What's up? Today is Friday. Friday. What's going on, world? What's going on? Goodness. What's up? How y'all doing? Today is Friday. We're going to go over NCLEX style questions. We're going to be talking about all kinds of stuff. Seeing who decides they want to jump up in here. We're going to get it on and pop it today. If you're new, I want to know who you are. Happy Friday. What's up, abs? Happy Friday. Hey, so today we're going to go over, once again, as requested, we're going to go over NCLEX style questions. But we're specifically going to focus on fundamentals. Okay? So we'll look at fundamentals. We'll talk about those. We'll go through them, have a good time. So shout out to everybody that's jumping into the live. Hey, I want to know who you are, where you're from, and where you are in your nursing journey. Like I said, today is Friday. We're going to go over NCLEX style questions. My co-host, Nurse Nelly, is here. Just cleaning my house and about to make some brownies, ready to answer some questions. That's what I'm talking about. What kind of brownies you making over there? Let us know. Let us know down in the comments, like what kind of brownies you over there making. They the ones that got like the caramel and the walnuts in them. Hey, those is good. Like the turtle ones, those is delicious. You know what I'm saying? Shout out to all 6 of y'all that are joining in. Shout out to all 6 of y'all. We'll get a good amount of people that are coming up in here, and then we'll turn around and we'll start knocking out some questions. Hey, today's Friday. Hopefully everybody had a good week. Hopefully everybody had a good last, 2 days. It's been 2 days since I've seen y'all. So, hopefully everybody's doing well. Your boy he's tired. He's been up early, so I got a Monster, not sponsored. And this one is the Ultra Peachy, because we ultra peachy around here. You know what I'm saying? So I'm thinking about some classic ones with chocolate chip. Okay. Shout out to you. Does that say Labriziana? Like bust down Labriziana. I'm just playing. Shout out to all 16 of y'all that are up in here. Happy Friday. Happy Friday. Hey, if you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse. All social media platforms. You're studying heart defects. Okay, shout out to you. I have watched your lives a few times and I just passed the NCLEX. Thank you so much. Shout out to you. Shout out to you, Sam. Congratulations on passing your NCLEX. I had no doubt. Everybody that's in here, make sure you guys give Sam some love. Let Sam know that you embarked on that journey and you did one hell of a fucking job. I'm proud of you. Even though I've never met you, I'm proud of everybody that's in here. Shout out to all 40 of y'all that are in here. Help there is a snack in the backyard. Don't know what that means. No idea what that means, child. No idea what that means. Nelly, I know who that is, but it's okay. It's okay. I know why you did it. But shout out to you. Shout out to you. What's up, Nika? How are you? I'm good. Today's Friday, hot. It's hot. Anybody, lives in the lower part of the country, we getting this heat wave. That's how we doing it. So, hey, Kevin, I'm studying fluid and electrolytes at the moment. Advice. Fluid and electrolyte imbalances. So what is that? Hypokalemia, or your kalemias, your calcemias, your natremias and magnesiumia, stuff like that. South Louisiana. Look, I know it's hot there. You drinking tonight? I don't even drink like that. I mean, I'm drinking this, this Monster, this Ultra Peachy King, because that's what I'm about, because everything is peachy around here. So shout out to all 92 of y'all in here. Hey, a couple of housekeeping things. Welcome. I want to know who you are, where you're from, where you're at in your nursing journey. NCLEX, I don't care how many times, so on and so forth. I want to know all that. If you're a brand new nursing student, if you are doing your prerequisites, we want to know all that stuff down in the comments. My co-host, one of them, Nurse Nelly, she will be hanging out in the comments. So make sure y'all don't act up, because she will mute you. But she's been a nurse for 4 years, working in med-surg, tele, ICU, and now does case management, loving her life. So, that's how that rolls. We're going to do these NCLEX style questions. I just wanted to make sure y'all smash that like button. Make sure you guys share. Hey, shout out to the gang. The gang is in the house. We appreciate you, big dog, for being here. So yeah. We're going to get into it, but make sure you guys share. The more shares that we get, the more that we can get out to the people, and make sure you guys like, because the more likes that you guys give, the more questions that you guys get. So what's up, Nurse Honey? What does it say? BSN, New Jersey. Shout out to Jersey. ER manager, 12 years. what is that? Quality utilization. I'm guessing that's what it is. 5 years. Shout out to you. Just schedule my NCLEX date. Take it on the 16th. That's what I'm talking about. Hey, by scheduling your date, that makes it real. And I would hold you accountable to making sure that you study. So don't be afraid. Do not be afraid to schedule that exam, because regardless, whenever you take the exam, the results are already in. You know what I'm saying? Just graduated. Shout out to you. What's up, user 24? How are you? Hey, so we got a good amount of people up in here. So we'll go ahead and we'll get this thing started. It says Archer or UWorld. I personally have used both. I think my Archer's better. I don't like UWorld because they don't give you like content or anything like that. They just give you rationales. But depends on you and how you study. All right. Appreciate the rose, big dog. Appreciate you. All right, cool. Now let's get it. Quality improvement specialist. Got you. I bought Archer last night, and let's just say them practice questions are A1. Yep, I like them. They're pretty good. You're welcome. So said I'm a student. All right, cool. So let's go ahead and turn this thing around. All right. So per request of somebody on the last live stream, they were like, can we go over fundamentals? And specifically, they said go over fundamentals because they were already they're like in their first semester of nursing school. And I was like, you know what? Cool. Whatever. Right. Whatever's fine. And I'm cool with that. All right. So we're going to go over fundamentals, because fundamentals is still part of your NCLEX, right? I know we're specifically doing things like that are NCLEX related, but fundamentals never go away, even once you become a nurse. All right. So shout out to all y'all. Hey, so you already know what the deal is. We're doing NCLEX questions. Participation is the key. I want you guys to participate, answer as much as possible. All right. And I'm kind of sort of not really, but really funny. So I mean, if you think I'm funny, cool. Smash the like button and share. If you don't think I'm funny, smash the like button and share. So next up, hey, the more likes you get, the more questions that you get. Hey, but whatever. Do you, boo? Guess how many likes I want? And guess how many y'all got to dish out? All of them. There it is. Hey, we need to get to 10,000 likes so I can stream on the computer. Because, the streaming from the phone is ghetto. And if y'all want me to be unghetto, I mean, if you ought to follow me and just let folks know so they can follow me too. I always talk about the 7-day NCLEX course. What is that? That's my course that I created. It's in its pre-launch phase right now. We are adding content as well as adding NGN Q&A videos to essentially this right here. That's going to be going into the program, but it's going to be going a lot more in depth, and I'll be able to take my time, so on and so forth. And that's on demand. And you guys can check that out. Link is in the bio. $48, 80% off of the current price. Once you get it forever. Jenny, of course, we not ghetto, but we all ghetto out here. You know what I'm saying? So yeah, make sure you guys check that out. If you're a brand new nursing student and you don't take your NCLEX for another year or two, or if you don't take NCLEX for another 6 months, hey, there you go. All right, $48. You spend more on Amazon. You already know it because I do. I'm just saying. Another thing, don't troll my chat. If you troll my chat, you're going to get a 600. A 600 is 600 seconds, which equals 10 minutes. And that's how long you're going to get banned. And I usually do it on a democracy. I'm like, chat, what do y'all think if somebody's in here trolling? And as soon as one person puts 600, and if it's valid, then they're going to ban world. And I'm not going to do it. Nurse Nelly's going to do it because she knows what's up. And also there's no gatekeeping, right? I got these questions off nurselabs.com. They also have like nursing diagnosis and all kinds of stuff. If you're a brand new nursing student, if you're trying to learn like your NAN does, all that good stuff. They got a lot of good stuff over there. So, hey, I'm about it and I'm here for it. All right. So on to the question. So let's see what we got. The most important nursing intervention to correct skin dryness is what? Consult the dietitian about increasing the patient's fat intake and take necessary measures to prevent infection. Is it B, ask the physician to refer the patient to a dermatologist and suggest that the patient wear home laundered sleepwear? Is it C, encourage the patient to increase their fluid intake with irritating soaps when bathing the patient and apply lotion to the involved area? Or is it D, avoid bathing the patient until the condition is remedied and notify the physician? We got C's, we got C's, we got C's. All right. So depending on where you are in your nursing journey, these could be extremely easy for y'all. Right. These could be extremely easy for y'all. So I got a whole bunch of C's, But for those that are like right there at the beginning, these could be pretty difficult for you. OK, so we got C's, we got C's, we got C's. So remember, the key word is most important. I hope everybody can see that. What I can do, I feel like it's a little small. So what I'll do, see if I can make this a little bit bigger. All right, let's see what we got. I think everybody can see that. It's a little bit better. So like I said, ghetto, and I'm trying to be unghetto. You see what I'm saying? So we got a lot of C's, Another thing, I want to try to give people ample time that decided they want to jump up in here and answer questions. So don't be trying to rush me. All right. Can I get the answer? You'll get the answer when I give it to you. All right. Oh my God. I'm just playing. Shout out to y'all. So we got a whole bunch of C's up in here. I haven't seen anybody change up anything. So we'll go with C and we'll see what it is. And of course, the answer is C. You want to encourage the patient to increase their fluid intake using non-irritating soap when bathing and apply lotion to the improved areas. Dry skin will eventually crack. Shout out to eczema. No, I'm playing. But was it ranking the patient more prone to infection? And that's true. To prevent this, the nurse should provide adequate hydration through fluid intake, use non-irritating soaps or no soap when bathing the patient, and lubricate the patient's skin with lotion. In most cases, dry skin responds well to, lifestyle measures. These are really small, so it's kind of hard for me to read it. Such as using moisturizers and avoiding long hot showers and baths. Moisturizers provide a seal over the skin to keep water from escaping, and applying moisturizer several times a day and after bathing. All right. I think that, like I said, that one was pretty easy for most, right? So like I said, there'll be some that'll come in here and they'll be like, man, what's up with that? Like, I don't understand why I got it wrong, so on and so forth. So when you're studying your NCLEX questions, it doesn't matter how easy you think it is. Always read your rationales and then always see why these are incorrect, even if you got the answer wrong. Okay. Shout out to all 70 of y'all that are in here. All right. Next question. When bathing a patient's extremities, the nurse should use long, firm strokes from the distal to the proximal area. This technique provides an opportunity for skin assessment. Is it B, avoids undue strain on the nurse? 3, increases venous blood return? Or is it C, causes vasoconstriction and increases circulation? What's too big? Pass my dog, that's what I'm telling. Who is that? DeWood said that? He's like, pass my M and F and NCLEX today, Kev. Is crazy. Thanks for the help, man. Hey, everybody show him some love. That's what I'm talking. Hey, DeWood been up in almost every live that I've done. So, yo, that's what I'm talking about, bro. Hey, congratulations to you. Everybody show DeWood some love. My man passed that NCLEX. That's what I'm talking about, bro. Hey, like I always say, get off that beach. And now you off that beach. So now you can get out there and make that money. You see what I'm saying? I'm proud of you, man. I'm proud of you, bro. I'm proud of you, man. I really am. So I got distracted by that. I got so many answers. So I got C, I got D, I got A. Well, Ashley now says D. Amber said D. Medic said D. Medic said A. Medic. I'm gonna need Medic 1. I'm gonna need for you to make up your mind. Remember, hey, usually your first answer is the correct answer. Okay. Got C, D. Casey says A. Does it say, it says Ray. So I'm going to say, Ray says C. Wild Living says 1. Honey says 1, says C. Honey said D. Okay. Look, Medic 1, don't say okay, D. Like, you're not convincing me. You have to convince yourself. And remember, this is practice, right? So if you get it wrong, understand why you got it wrong by reading the rationale and reading the ones that you got incorrect, those answers and those rationales. Okay. All right. So we're kind of all over the place. We have some D's, have some C's, have some A. A good way to answer NCLEX. If you can only do one thing before leaving the room, what can you do? That depends on what the question is, right? So if the one thing, what if it was a first thing? Right. But what if it was a most thing? Or what if they were unstable? Now, what if they were stable? What if it's chronic or acute? Right. So I like where your head is at, Maria, but based off of that specific one, it's like, if I could do one thing and leave, what would I do? If I could do one thing that would save my patient, what would it be? Right. That's what we call like the most important. Right. Because it's like, hey, what is going to go to priority? Right. All right. And then question. The answer is C. We want to increase venous blood return. Washing from distal to proximal areas stimulates venous blood flow, thereby preventing venous stasis. Good personal hygiene is essential for skin health, but it also has an important role in maintaining self-esteem and quality of life. Supporting patients to maintain personal hygiene is a fundamental aspect of nursing care. Hey, best friend. Hey, so here goes my other co-host. Shout out to Nurse Cass. Nurse Cass been a nurse for 17 years, does corrections and psych. She's like my bouncer. She will fight you. She has hands. Try Jesus, not her. Okay. So shout out to y'all. Is ATI harder than NCLEX? Yes, ATI is harder than NCLEX. I actually don't like ATI at all or HESI, but that's my opinion. But, because I didn't feel like either one of those, well, especially HESI, I didn't feel like HESI prepared me to take NCLEX at all. I just passed my NCLEX. Hey, shout out to you, Hannah. Hannah, banana, Fana. I'm sorry. I'm pretty sure you got that your whole life. Shout out to you, Hannah. Everybody show Hannah some love. Everybody show Hannah some love right now. Let Hannah know. Welcome to the shit show. I'm just playing, but congratulations to you. Hey, look, that's two people today. What, DeWood just said that? Hannah just said that? Who else gonna tell me some good news today about y'all passing these NCLEXs? You see what I'm saying? That's three. That's three new nurses, and that's what I'm talking about. We got three new nurses in the chat. Three new nurses in the chat. That's what I'm talking about. You want to know why? Because this is the part of the environment that we want to foster, right? And so I'm gonna tell y'all one thing, and this is going to the two that passed, and this is going to all 91 of y'all or the rest of y'all that are going to eventually pass, right? Is you need to pay it forward. Pay it forward. Find somebody that you can mentor and pay it forward. That's all I ask. And then, of course, buy my shit. But anyways, but no, but in all seriousness, pay it forward. Pay it forward because you never know who's going to need it. All right. I promise you that. I love this environment, man. This is a really huge help for the new nerd. That's what I'm trying to tell you, man. I never had anything like this. I wish I would have had something like this, but I never had anything like this. And now I just like to I love to get on here and I love to do this. I love to do it. All right. So shout out to y'all. So hard to find a nice mentor. Look, $9.99. I got you for a penny to make me $10. I got you. REM stage. Okay. So you got mentors up in here. Everybody up in here is a mentor, right? Everybody up in here is a leader in one way, shape, or form. Okay. All right. Question number 3. Vivid dreaming occurs in which stage of sleep? Is it stage 1 non-REM? Is it REM stage? Stage 2 non-REM or delta stage? We got some C's. We got some B's. We got some all kinds of stuff. I love that you do this. Makes my second chance of going back not as scary. Look, hey, if you're scared, what do I always say? If you're scared, what? You ain't got nothing to be scared of. Right? But usually I say, if you're scared, go to church, right? You ain't got to be scared. Don't be scared of nothing. Don't be scared of nothing. Yeah, that's right. Go to church. You already know what the deal is. REM. Okay. All right. Shout out to y'all. Hey, make sure you guys share. Celestial System says, REM. Is it Marcia? All right, cool. Got you. Says B. All right. So let's see what the answer is. So the answer is B. It is rapid eye movement stage. Other characteristics of REM sleep are deep sleep, depressed muscle tone, and possibly irregular heart and respiratory rate. This is a stage associated with dreaming. Interestingly, the EEG is similar to an awake individual, but the skeletal muscles are atonic and without movement. The exception is the eye and diaphragmatic breathing muscles, which remain active. The breathing rate is altered, though, being more erratic and irregular. This stage usually starts 90 minutes after you fall asleep, and each of your REM cycles get longer throughout the night. The first period typically lasts about 10 minutes, and the final one lasts about an hour. All right, so hey, sometimes you could have a dream that lasts 10 minutes, and you'll be like, man, that's wild. That's wild out here. That's wild. What else we got? You're supposed to be frozen and your eyes move. Yup. Right. So these are NCLEX questions, right? But I'm going to ask, so a lot of people are going to ask me, hey, are these NGN questions, right? So the NGN, they didn't get rid of the multiple choice questions. They did not get rid of multiple choice questions, select all apply, so on and so forth. They have added additional questions. And all those questions are essentially they've delivered the questions in an updated package, but they still have the old ones there. Okay. So don't get confused on why do I have these multiple choice questions, because they haven't gone away. All right. What do we got? The natural sedative in meat and milk products, especially warm milk, that can help induce sleep is it flurazepam, temazepam? Is it methotrexate? trimethoprim, and tryptophan. There it is. I was like, man. Hey, so here's the question. Now that I'm reading this, what meats can you find the answer? What meats do you usually there you go. Look at Tina. There you go. That's what I'm talking about. It's D. Nurse Cass says it's D. So you already know the answer is right. Casey. Is it Casey or Cassie? I'm going to go Casey. Casey says turkey. Lexi says turkey. V says turkey. Pepperonis. Yeah, look at that. A little something different over there. A little something different. Yes, KC, girl. Hey, I got you out here. I got you. All right, cool. It looks like we got a general consensus. We got some folks saying D. I don't think anybody else said anything different. Yeah, difference between nurses and doctors. Doctors know the why. That's not necessarily true because nurses have to know the why as well. It's just that there's a difference between nursing and being a doctor. That's not true. All right, here we go. The answer is D. Tryptophan is a natural sedative. And what is it? It's a natural sedative, and the rest of them are hypnotic sedatives. Protein meats such as milk and milk products contain the sleep-inducing amino acid tryptophan. Having warm milk at bedtime is a good way to work towards reaching the recommended number of servings of milk and alternatives each day, and can be a comforting way to unwind. Tryptophan is an amino acid that promotes sleep and is found in small amounts in all protein foods. This is a precursor to sleep-inducing compound serotonin and melatonin. Monies. All right. But it doesn't mean you know less. That's true. So here's the thing. Since, who was it that Luke said that? So nurses know the why. Essentially, everybody knows like the why. It's just the level of the why that they need to know. So a CNA doesn't need to know why specific things need to be done at a doctoral level. Is it good for them to know that? Absolutely. Right. But nurses do have to know why from a nursing patient standpoint. Doctors need to know why from a medical to nursing standpoint. You know what I mean? I mean, a medical to patient standpoint. Because remember, doctors do medicine and nursing is patient driven. You know what I mean? So it's not true, my friend. Not true. No shade on anyone's career path, but doctors really rely on the patient information from the nurse. Facts. That is 100% fact. Anybody that's ever worked bedside, you will know that 100%. Shout out to all 80 of y'all that are in here rocking with us. All right, we got number 5, nursing interventions that can help the patient to relax and sleep restfully include all of the following except having the patient taking a 30 to 60-minute nap in the afternoon, turning on the TV in the patient's room, providing quiet music and interesting reading material, or massage the patient's back with long strokes. I'm immature and I want to laugh, but I'm not gonna. You see what I'm saying? So I'm not gonna do that. What's up, Karen? How are you? Good evening. B for show. I got you. B for show. All right. So, hey, who knows my term? RTFQ. What does it mean? What does RTFQ mean? We got some people saying C, got some people saying B. What does RTFQ mean? Doctors know more of the medicine to prescribe and treat the illness. And yes, correct. I'm a PA, and love nurses. Hey, I love PAs. One of my buddy, he just became a PA. And there's a couple of PAs that I'm cool with at the hospital I work at. Love it. It's a it's separate non-pharmacological interventions. It better not be D. And what if it is? Maria? What you gonna do? Jump through the phone, punch my computer? Please don't do that. I really like this computer screen because it's all like glowy at the bottom. See what I'm saying? My friend is here. Listen, hey, shout out to your friend listening. Because now your friend is my friend. And now your friend is everyone's friend. You see what I'm saying? Shout out to y'all. Make sure y'all smash that like button. Make sure y'all share just because y'all love me. All right. So we're kind of all over the place. But remember, hey, nobody answered my question. What does RTFQ mean? That's fine. I'll answer it for you. RTFQ means read the question. It means read the fucking question. I censored myself, by the way. Right. So keyword nursing interventions that can help the patient to relax and sleep restfully include all the following except, meaning all of these are right, but one is not right. So which one is not right? Remember, read the question. I've literally seen questions that are this easy that people have missed. And also I have missed because I didn't read the question. All right. We got A's, we got D's, we got B's. Y'all are all over the place. Let's figure out what the answer is. The answer is A. Having the patient take a 30 to 60 minute nap in the afternoon. Napping in the afternoon is not conducive to nighttime sleeping. Damn, definitely read it wrong. See what I'm saying? I missed a question for reading it too fast. What did I just say? As a matter of fact, wait, who said that? Casey, was that you? Oh no, that was Bella. Ooh, I don't know why. I wanted to go after Casey. I don't know. I'm waiting for Casey to mess up. I'm waiting, Casey. I'm picking on you. You're the one. You're the one today. You're the one. So as soon as you mess up, getting the finger. Getting it. All right. So, like I said, there are a few considerations about naps. For example, a short daytime nap of 15 to 30 minutes can be restorative for elderly and will not interfere with nighttime sleep. On the other hand, insomniacs are cautioned to avoid naps. Quiet music, watching television, reading, and massages usually will relax the patient, helping them to fall asleep. Me personally, I can't watch TV before I go to sleep because then I want to stay up and watch Dragon Ball Super all night. And because that's usually what I watch. I watch anime. Shout out to everybody that likes anime. And if you don't like it, then you can get a 600. No, I'm just playing. I'm not going to 600 if you don't like anime. But you already know the deal. I'm just saying. Hey, shout out to everybody that likes Attack on Titan because that's my favorite anime right now. As a matter of fact, anybody in here watch anime? Y'all let me know what anime y'all like. Drop it down in the comments. Drop it down. I love learning from the rationale. That's what I'm saying. Like, I love learning from the rationales as well. That's one reason. But here's one thing is that I'm all about things being all inclusive. Like, hey, give me questions, give me answers, give me rationales, give me content videos, give me all kinds of other things. Give me other avenues, that I could use. I'm not saying more is better, but then like if everything is under one package, love it. Sorry, I'm a masseur that is outside of my scope of practice. That's okay. Jujutsu Kaisen. I tried to watch it. I tried to watch Jujutsu Kaisen and I could not get into it. I could not. One Piece. Is it really the new live action? Shit, I'm going to have to check that out. Shout out to all 60, 80 y'all that are in here rocking with me. If you are new here, welcome. We are doing NCLEX questions specifically in fundamentals. I am Kevin, your gracious host. I go by the Boot Nurse on social media and all those platforms. So YouTube, Instagram, Thread, X, all that good jazz. I want y'all to go and I want y'all to go follow me over there. Anybody that misses these TikTok lives, they will go up on the YouTube channel within a day or so, or within a couple days, just to make sure that everything's good to go. And those will go up there. I want you to participate. I want to know who you are, where you're from, where you're at in your nursing journey. Did you just pass your NCLEX like the two that are stunting in my chat right now? Are you about to start nursing school? Are you a nursing prereq student? Did you graduate already? Like, we want to know who you are, where you're from, and where you're at in your nurse journey. Make sure you guys participate. Participation is key. I'm kind of sort of not really funny, but whatever, to each their own, you know what I'm saying? So, the more that you like or give gifts or whatever, the more questions that you guys get. But whatever, you do you. You do you, boo. What else? Hey, we got some questions on here. So guess how many likes you got to dish out? All of them. Not some of them. Not a few of them. All of them. I'm just saying. Make sure you guys dish them out. I want to see them. Hey, we need 10,000 followers so I can stream on the computer. Because the phone is ghetto. You see what I'm saying? Like, I got to do all this. I got to do all this. I got to do all this. Ain't nobody trying to do all that, right? I'm trying to, up my game so I don't look ghetto. You see what I'm saying? So make sure you guys help your brother out with that. You know what I'm saying? I will always talk about the 7-day NCLEX course. If you don't know what that is, if you're new here, 7-day NCLEX course is the NCLEX course I created because I never want anybody to feel how I felt. Lost, didn't know what to do, failed the NCLEX. Y'all, I failed my NCLEX 3 times. Three times, right? And you want to know why? It's because I had no direction. And then somebody gave me direction. Mentorship, I'm all about, right? So now I understand what it's like to go from point A to point B. And my whole goal is creating that is to help everyone else get from point A to point B. So 7-day NCLEX course, the link is in my bio. It's in its pre-launch phase. So we are building the plane as we're falling from space, whatever you want to call it, right? So $48, 80% off. And once you get it, it's yours forever. Okay. So, and you get every update that's coming in there. So if anybody's interested, make sure you guys check that out. Link is in my bio. Hey, if you're in my chat and you troll my chat, you're going to get blocked. We call that a 600. You act up, you're getting blocked or you're going to get muted. One of the two. All right. Nurse Nelly, who is my co-host, Nurse Cass, who is also another one of my co-hosts. You act up, they're going to block you. All right. Just letting y'all know that. Also, I don't gatekeep. I got these questions from nurseslabs.com. If anybody's interested in looking at whatever other questions for themselves, they have a good, decent batch of questions over there for you if you want to look at those, as well as if you're a brand new nurse or about to start nursing school, they have really good nursing diagnosis that are there as well. All right. So make sure you guys go over there and check those out for yourself. I saw a whole bunch of people talk and a whole bunch of people say stuff, and I want to answer them. What does getting a 600 mean? Hey, Bella, getting a 600 mean? Oh, yeah, I already said it. Getting a 600 means you're about to get banned. Bella, we don't want to ban. We don't want to ban you. We don't want to ban anybody that was in the Twilight Saga. Okay, I'm just playing. I'm just joking. What's up, Kelly? I'm in integration. Okay, not too much talking, not enough questions. Well, I'm sorry if I'm talking too much. Then you can leave, sir, or ma'am, or whatever you identify as. So here we go. We're doing some more questions. What does it say from some? I take my PN in 4 days. Shout out to you. Is it Tylette? You're gonna do all right. You're gonna do just fine. I promise you that. So question number 6: restraints can be used for all of the following purposes except to A, prevent a confused patient from removing tubes such as feeding tubes, IV lines, and urinary catheters. Is it B, prevent a patient from falling out of the bed or chair? D, discourage a patient from attempting to ambulate alone when he requires assistance for his safety? Or is it D, prevent a patient from becoming confused or disoriented? I did not expect nursing diagnosis process when I started nursing school. Trust me, most of us don't, because we all try to think that we're going to go be doctors, and that ain't it. B, BB says B. BB says B. Bryce says C. Casey says B. Jal, is it Jal or Jal? Says C. Honey says D. Bella says D. Emma says D. For sure. For sure. I got you, Casey. I got you. All right. D. All right, we got D's. We got some A's up in here. Okay. Michaela, what'd you say? Said D. Okay. Shan says D. Jasmine says D. JC says A. Okay. Sarah says C. What it says, either way, you need a doctor's order. Hey, so answer this question. On NCLEX, do you have the doctor's order? Yes or no? And yes, either way, you do need a doctor's order. But regardless, do you see anything on here where it says anything about you needing a doctor's order? On NCLEX, you have the right amount of people. You have the right amount of time. You have the right amount. You have the order. The NCLEX is perfect world, right? So you have everyone and everything you could possibly need. All right. So Utopia Hospital. Look, OK, we ain't even going there. All right. So let's see what the answer is. So the answer is D, prevent a patient from becoming confused or disoriented. Now, once again, did we RTFQ? Did we RTFQ? What does RTFQ mean? We've already talked about that. Shout out to all 165 that are in here rocking with me, right? Did we RTFQ? Restraints can be used for all of the following purposes. I'm new. What's that? RTFQ? Hey, y'all let her know what RTFQ means. Right? All right. So I'm going to read the rationale. Hey, remember, I didn't make these questions. However, remember, this is perfect world, book world. What you do in the real world is totally different. I RTFQ. That's why I got it right. So that's what I'm talking about, Bella. That's right. Read the question. Read the explicit F word question. All right. By restricting a patient's movements, restraints may increase stress and lead to confusion rather than prevent it. Restraints in a medical setting are devices that limit a patient's movement. Restraints can help a person from getting hurt or doing harm to others, including their caregiver. They are used as a last resort. The other choices are valid reasons for using restraints, right? But once again, it said restraints can be used for the following purposes, except to, right? So all of these are right, except for this last one. Okay. All of these are right, except for one, right? Blah, 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 except one's not right. Okay. Remember, you have to read the question. You always have the doctor's order. Does anybody see anything about a doctor's order in here? If you start throwing in, if you ask yourself while you're taking this test, oh, do I have the doctor's orders? You're going to get it wrong because you're going to hold on to that. You're going to hold on to it. So do not do that. All right. So we got that. Man, I love y'all. Appreciate y'all. Shout out to all 120 of y'all. Make sure y'all keep smashing that like button. All right. Number 7. Which of the following is the nurse's legal responsibility when applying restraints? Is it A, document the patient's behavior, document the type of restraints used, obtain a written order from the physician except in an emergency when the patient must be protected from injury to himself or others, or is it all of the above? And we just talked about that. Danielle says C. Bella says D. BB says D. Masterpiece, what's up? How are you? Says D. Kelly says A. Is it Lynette says D? Okay. All right. I think we're getting somewhere. Let's see what the answer is. And the answer is D, of course, all of the above. When applying restraints, the nurse must document the type of behavior that prompted him or her, because I don't know if you guys can see that. Hold on. It's kind of blurry. There we go. That's better. I'm good, Masterpiece. So, him or her to use them, document the type of restraints used and obtain a physician's written order from the restraints or for the restraints. Nurses are accountable for providing, facilitating, advocating, and promoting the best possible, patient care, and to take action when the patient's safety and well-being are compromised, including when deciding to apply restraints. How many questions are we doing? Tam, we're going to do many of them. I was, what did I say? Like, I was predicting this question. That is why I said that last time. I figured that's why. But hey, remember, some people aren't there. And I'm going to be completely honest with you. If you get a question like this on NCLEX, like when you're going for your license, this is a general question. Is this a passing level question? Yes or no? And by passing level, I mean, is this a difficult enough question that requires clinical thinking and critical thinking and clinical judgment? So these questions, when you see them, if you get a question that's like this on NCLEX, you better pause and you better recollect yourself. Okay, because if you're starting to get easy questions, because me personally, I consider this an easy question. This is something that you should already know, right? But if you start getting easy questions like this, you might want to think to yourself, hey, I need to slow down and I really need to read this question and I really need to pay attention. What am I not getting? When I took my second exam at 265 questions, this is exactly a type of question that I got. Okay. So pay attention. Pay attention to that. What is that? Kubler-Ross's 5 successful stages of death and dying are, is it A, anger, bargaining, denial, depression, acceptance? I ain't even going to read the rest of them. Y'all read the rest of them. Y'all tell me. All right. We got some A's. We got some C's. Hey, so what's the acronym for it? Like, just write it out. Like, there it is. JC said it. DABDA. Okay. Right. There it goes. DABDA. 100% C. All right, Carissa, I see you. DABDA. We got C. Okay. All right. Well, let's see what the answer is. We don't even got to hold on to that. All right. So the answer is C. Denial, anger, bargaining, depression, and acceptance. The patient may move back and forth through the different stages as he or his family members react to the process of dying, but he usually goes through all stages to reach acceptance. All right. You never knew that? Okay, BB. Hey, look. We here for it. So, in case you didn't, I don't remember the order. So, DABDA. If you never know, it's DABDA. Are you doing maternal? No, we're doing fundamentals. That's what we're doing right now. Per the request of somebody who said, who asked about it last week. I know who've been listening to Mark Klimek. Man, what do you mean? I did listen to Mark Klimek a lot. I love Mark Klimek, actually. He's actually like a really an inspirational person to me in regards to passing NCLEX and, being an instructor for it, so on and so forth. I knew it, but I didn't know the order. Thanks. Okay, no worries. But yeah, DABDA, denial, anger, bargaining, depression, and acceptance. That's dope. I'm trying to tell you. I love Mark Klimek. That's good stuff. I have my exam 2 on fundamentals coming up next week. Shout out to you, Masterpiece. Look, hey, so this is for you. It's the order. All right. Look, this stuff like this is for you. Right. And some of us nurses, we be forgetting. So, these are like really good refreshers for us. Right. Number 9, a terminally ill patient usually experiences all of the following feelings during the anger stage, except rage, envy, numbness, and resentment. Remember, key word, accept, Right? Yes, Mark Klimick, the maternal, is a lifesaver for my exam right now. That's what I'm look. I loved his stuff for the maternal stuff. Hell, even the arterial blood gases. That's honestly that's how I teach people. Is I love to use his arterial blood gases lecture as I'm teaching. They're like, oh, I'm like, look, all in all, we all trying to do the same thing. Get a license, get out here and make this monies and take care of these patients. Bella says C. I don't know this one, but this one's not similar to anger. C. Tam says numbness. Masterpiece says C. Okay. All right. Shout out to all 145 of y'all up in here. Keep those likes going, baby. We had 10,000. That's what I'm loving to see. Appreciate all the shares too. Make sure you guys keep sharing. Hey, make sure you guys follow as well, because who wants to keep streaming like this? This is ghetto. Ain't nobody trying to do that. Whose lecture on ABGs? Mark Klimmicks. Thank you for the follow. Thank you guys for the follow. Hey, the more follows, the better. No, this is not Archer. This is wait, who asked that? Archer what, Jenny? Whose lectures on ABG? No, not Archer's. Mark Klimmicks. There he is. Numbness. Oh, okay. Thanks. Gotcha. Here we go. And the answer is C. It is numbness. Numbness is typical of the depression stage when the patient feels a great sense of loss. Depression is perhaps the most immediately understandable of the Kubler-Ross's stages, and patients experience it with unsurprising symptoms such as sadness, fatigue, and anhedonia, whatever. Like I swear to you, I don't even remember seeing that word in nursing school. That's wild. But spending time in the first three stages is potentially an unconscious effort to protect oneself from their emotional pain. And while the patient's actions may potentially be easier to understand, they may be more jarring in juxtaposition to behaviors arising from the first three stages. Okay. So I noticed that too. That's a lot of new words. That's what I'm saying. Like, bro, I don't even know where that word came from. And I ain't got no problem telling you what I don't know. It's in the textbooks. Trust me, or it wouldn't be there. I'm just saying, but I ain't got no problem to tell you, hey, yo, I don't even know what that word is. Unable to feel emotions. I think, okay. Hey, ain't nothing that a quick Google search can't tell me. It's common with schizophrenia. Look at you, Tay. Shout out to you giving us the definition, and it's common. I love that. That's what I'm talking about. Shout out to y'all. We're going to roll to the next one. All right, here we go. Question number 10. Nurses and other healthcare providers often have difficulty helping a terminally ill patient through the necessary stages leading to acceptance of death. Which of the following strategies is most helpful to the nurse in achieving this goal? Now, the key word to this is most. It is most. I'll answer your, is it Cole? I'll answer your question here in a second. Is it A, taking psychology courses related to what? There it is. Reading books and other literature on the subject, reflecting on the significance of death, reviewing varying cultural beliefs and practices related to death. Man, apparently I don't know how to talk. It's crazy out here. Cole said a question. Let me see what you said. You said something that was off topic. How accurate is the Pearson View trick? I took my NCLEX today and I'm wondering. Thanks. So the NCLEX trick is 99.99%. I've seen people get the good pop-up and fail, and I've seen people get the bad pop-up and pass. However, to each their own. You can do it yourself. You can look at the videos that I posted in my TikTok and you can see it. Okay. You can see how the process goes, or you can go to YouTube and watch the whole process without interruption or whatever you want to do. But it's accurate enough to kind of calm your anxiety. But, the only way that you're going to know is when you get your freaking quick results back and then you get a license number. So, and that takes 48 hours from the time that you took it. So if you took it today at 1:30 or 1 o'clock, you'll get it 48 hours. So today you should see it Sunday, no later than Monday at 1 o'clock. All right. So answer, it is C. The answer is C. Reflecting on the significance of death helps to reduce the fear of death and enables the healthcare provider to better understand the terminally ill patient's feelings. It also helps to overcome the belief that medical and nursing measures have failed when a patient cannot be cured. So I can tell you right now that there's so many things that we have done as nurses that have taken when it comes to taking care of patients. And we're just like, what have we done wrong? Like, what could we have done? And I'm telling you right now, for every dying patient that I've ever been around, unless I know that they're, terminally ill, it's just like, what could I do that like help ease their pain? Like that's a real thing. That's a real thing. What do you think of the registered nurse RN? I think registered nurse Sarah from registered nurse RN, I think that she's good. I personally have an environmental like barrier for her because her accent is so thick, but her stuff is very, very helpful for nursing school. Because I used her. I thought she was great. So there was another question on here. Can you show the question again? Sure. Passed my med surg final this week. Shout out to you, butterfly. Oh, I don't know if this is a bird. You know what I'm talking about. Shout out to you. Shout out to you. Wow, we all got it wrong. It's okay. It's okay. Simple nursing is helpful too. I liked his for pharmacology, which I thought was great. All right. Hey, we're at another break. Shout out to all 98 of y'all that are in here. We're doing NCLEX questions specifically with fundamentals. Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Let us know. Have you taken NCLEX? You passed it. We had 2 people that jumped in here that passed it today. Love it. Right. And I love how we can foster a great community up here. And I want everybody to jump in. I want everybody to do that. Love it. Love it. Love it. Hey, participate. Answer the questions. All right. Answer the questions. I'm kind of sort of, but not really, but really funny. I'm just letting you know. And if you don't like that, then that's fine. The more likes that you get, the more questions that you get. So we're at like 12K right now. We probably need a minimum of 25. I'm just saying. But hey, if you don't want to give me those likes, then whatever, you do you. I want all of them. I want all the likes, all of them. Give them to me. Hey, we need 10,000 likes so we can stream on the computer. I'm just saying, let us be unghetto. Okay. 7-day NCLEX course. Like I said, hey, that link's in the bio, $48. It's in this pre-launch phase. So we're updating stuff. So $48. Once you get it forever. So check that out. If you're a brand new LPN or a nursing student going into school, if you're taking your NCLEX in 6 months to a year, perfect for you. Don't troll my chat. You're getting 600. What's a 600? That 600 equals a ban. And by a ban, I mean you get banned from my chat, not a ban of money. Grow up. Also, I don't do gatekeeping. I don't gatekeep. So I got these. I'm telling you right now where I got these questions from. They're from nurseslab.com. They're pretty good questions depending on where you are in your nursing journey. So boom, there it is. Is it a flat rate? Yes, ma'am, it is. It's $48 and that's it. Because it's in that's the price that it's going to be until the program is completely done, and then the price will change. So for early adopters, you get everything that I'm adding in there. Once it's done, everyone else is going to get something different. Is NCLEX similar to ATI test questions? Not really, Lexi. They're not. They're harder, and the way that they word the questions, I don't like. I would rather, if it came to questions, me personally, Lexi, I like either UWorld or Archer or Kaplan's questions. I think Hearst review, her stuff is okay too. Remar, hers is okay too. But yeah, no, I don't gatekeep. Don't act up. Hey, I got my co-host down in the bottom. I got Nurse Nelly and Nurse Cass. They're both nurses. One's been a nurse for 4 years. One's been for 17 years. They will ban you if you act a fool in my chat, and they won't tell you. I'm just saying. Hey, if anybody's in here acting a fool, and hey, democracy, 600. Somebody tell me, hey, somebody getting a 600. We're going to evaluate, and they're going to get a 600. All right. So shout out to y'all. Keep sharing, keep liking. Let's go on. All right, here we go. Which of the following symptoms is the best indicator of imminent death? Is it a weak and slow pulse? Is it a increased muscle tone? Is it fixed dilated pupils, or is it slow, shallow breathing? I need a bridge program know of any. Grant, I think I know WGU is one. I think Capella has another one. I think Chamberlain has one. It all just depends on where you live. Definitely, you can definitely check those out. I'm a first semester nursing student at Florida State University. Was it the Knowles Seminoles? I'm pretty nervous. Well, don't be nervous, Chris. Don't be nervous, sir. P, what is imminent? What's imminent death? Means death is upon us. I mean, death is coming. Got a bunch of D's. No, you didn't just say F. Fixed dilated pupils. Okay, that's a good one. New York. I'm not sure about New York, but I know online classes wise, or online school wise, I would look at like WGU. I would look at Capella. I would look at what's that other one? Chamberlain, so on and so forth. You meant D? Oh, I thought you was being funny. Lord of mercy. All right. The Knowles. Okay. All right. Boy, you about to pay a whole bunch for that nursing degree. Who asked? What do you mean who asked? I'm a community college. Okay. Shout out to you, Lexi. Shout out to you. We got C. Dilated fixed pupils. Okay. I'm at Cambridge College of Healthcare and Technology. Shout out to you, Carla. Michaela says D. All right, cool. Y'all are kind of all over the place, so let's find out what the answer is. The answer is C. Fixed and dilated pupils. Fixed dilated pupils are a sign of imminent death. Death is a part of natural life. Unfortunately, it is, and you got to accept it. However, society is notorious for being uncomfortable with death and dying as a topic on the whole. Many caregivers experience a level of burden from their duties during end of life care. So anybody that does hospice or anything like that, these are the things that you feel, right? This is a burden, and this burden is multifaceted and may include performing medical tasks, communicating with the provider, decision making, and possibly achieving or accepting the grieving of impending loss. So anybody that I've had multiple dying patients, from patients that have been on COVID, have had COVID on vents, to family members crying, to somebody dying from cancer, like you name it. Like, it's wild out here, and you got to be ready for it. You got to be ready for those signs that are happening. You'll start to see the breathing slow down. If you're looking at the pulse rate, you'll start to see the heart rate slow down. You'll start to see all kind of stuff that starts to happen, right? The sign of imminent death, I look for as a paramedic. Look at that, because I'm trying to, so what does it mean? What does it mean when you have fixed dilated pupils? And who's the paramedic? Don't answer, Shannon. Don't answer. So what does that mean? What does that mean when you have fixed dilated pupils? If we're talking about different systems in the body, what is that telling me? The one negative about Bridges Online: if you miss one step of clinicals, you fail the course. That's facts. That's facts. All right, Shannon, you can answer it. Maybe non-reactive, right? Non-reactive. But what system? The brain is there. You look at Tay. That's what I'm talking about. The brain. It's a neurological issue. Right? If I have fixed dilated pupils, big old pupils, that means I have a neurological issue. Yeah, exactly. CNS, neuro, right? So when you're doing your NCLEX, all right? When you're doing your NCLEX, this is what I mean when you have to use clinical judgment and critical thinking, because you got to know about, okay, like instantly I'm like, oh man, they're having a neurological issue. They're losing brain functions of some way, shape, or form. Okay? That's what that means. Right? Anybody that's had a traumatic brain injury, like if they have uneven dilated pupils, they're pretty much gone at that point, right? So that's the stuff. That's what I'm talking about. A lot of people will consider this to be an easy question, right? However, you gotta take the steps. You gotta find the trends. Okay? My teacher says, as long as you know what's normal, you'll be fine. That's facts. As long as you know what's normal is fine. However, what if you don't know what's normal? Karen, I'm sorry. Kevin, you seriously have to tutor me. Karen, I'll tutor you. You already look. Anybody that wants tutoring or anything like that, y'all can go to my website, thebootnurse.com. Go to the NCLEX Mentoring and Coaching, and if you want me to tutor you, I'll tutor you. Know what's normal and priorities. Okay, so let me ask you guys this question. This is all for all 125 of you. I'm gonna give you a little something different. Okay, so what if you had so the normal pH for a patient is 7.35 to 7.45. We all understand that. Now, like, what if I gave you a pH of 7.3? Right? All right, cool. We know that the patient is now acidotic. Okay. Now that the patient is acidotic, what am I going to be looking for that's going to be making me what? Am I metabolically acidotic, or am I respiratory? Okay. We're all going to be respiratory. We're all going to be metabolic. Now, what causes metabolic acidosis to go? Or what causes it to do that? Is it your kidneys? Is it your liver? Okay, now I need to look at my labs. Like, what do my labs show me? What's my creatinine look like? What's my bicarb look like? So on and so forth. That exactly, your ABGs. This is how you follow the trend. That's how you do that. Okay. And when you become a nurse on your floor and you have to do serial labs, or you have to check a patient, like you really have to check a patient's blood pressure to see what's happening with the meds, but also what do their labs look like based off of those meds. Okay, so think about that. Anyone have a good clinical bag suggestion? Oh, that's good. I don't know. The rocks bag. I don't know. I was going to actually make a video in regards to like, hey, like this is what's in my nursing bag. This is what you should have. But I feel like that's kind of girly. But if you want me to do that, I'll do it. Here's question number 12. A nurse caring for a patient with an infectious disease who requires isolation should refer to guidelines published by who? Is it the National League of Nursing, the Center for Disease Control, the American Medical Association, or American Nurses Association? B, 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 B. B, 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 B. Go Bayside. Bella says B with some LOLs. I got you. Wait, what? Do I start my first clinicals on Monday? Trauma and burns. So for those that don't know, my first experience of being a nurse ever was I worked in a burn ICU for 6 months, and it was some of the best training I ever received, ever. All right, so we got a lot of B's and only B's. So let's see if B is the answer, and of course B is the answer. The Center for Disease Control publishes and frequently updates guidelines on caring for patients who require isolation. CDC is responsible for controlling the introduction and spread of infectious diseases and provide consultation and assistance to other nations and international agencies to assist in improving their disease prevention and control, environmental health, and health promotion activities. Shout out to y'all for getting it all right. I'm in WBH. What is that? Women's Behavioral Health. Do we really have to know the different organizations? Yes. You do. You would need to know that. Absolutely. Our first clinicals is going to be a long-term care facility. I go next Wednesday. That's going to be fun. Hey, so remember, if you go to a long-term care facility, make sure you remember this. Those people live there. All right. So I'm just saying, oh my God, that's all you learn. That's all you learn in school is different organizations, right? Favorite nursing department. I like working in PACU, but I'll talk about that later. My second day. Okay. Just have my first clinicals on long term. Okay, Jake, tell us about it. Let us know. All right, here we go. To institute appropriate isolation precautions, the nurse must first know what? Keyword is first. So we're going to be going in a systematic approach. So 1, 2, 3, and 4. So I want to know what number 1, what is the very first thing we do, right? Or the first thing, the nurse must first know what? So is it the organism's mode of transmission? Is it the gram staining characteristics, susceptibility to antibiotics, or susceptibility to the organism? Nope. Oh, a mode of transmission. I want to say transportation, but I'm wrong. Mode of transmission. Okay. Contact, drop, and airborne. Where do you see that? Oh, you're talking about transmission. Okay. Why don't you just say transmission, Jenny? Why you gotta be different? Jenny, I'm talking to you. Why you gotta be different? Just say the letter. Say the letter. Shout out to y'all. Oh, okay. Who is it? Miss New? A. Alexis. A. Alyssa. A. Michigander 95 says D. Chris says D. Okay. Nobody says A 3 times. There's only one A here. Yeah. Or you need triple A? You like what? Your car broke down? What? Let me know. Are these questions based on the new? No, they're not. Like I said, I got these questions. Oh, Lord have mercy. I'm over here falling. Hey, think y'all can hear me. I think everybody can hear me. Cool. Everybody can still hear me? Almost had an accident over her. How often is NCLEX renewed? The NCLEX is revisited every 3 years. The NCLEX is revisited every 3 years and is essentially updated every 5 years, 3 to 5 years, but only like 5 to 10% of the exam is updated. Like it's updated so small, it's very seldom, like not enough to fail you, because I cannot imagine what would happen if they changed up 50% of that exam, right? Okay, pick the answer. Okay. Are you telling me what to do, or are you asking me? And if you are asking, please put a smiley face, because I don't know if you're being aggressive right now. A lot of case studies and select all that apply. What is the best NCLEX review? Depends on you, Naomi. Depends on you. It depends on you, how you study. A lot of people keep asking, what's the best review? I got told that UWorld was the best review, and UWorld did not work for me at all. No, just too much info. Hey, look, sorry. If it's too much info for you, I don't know what to tell you, because some people enjoy the elaboration of, knowing what these are. And that's what I talk about. Remar is the best. I like Kaplan, and people hate Kaplan. Some other people love Hearst and other people hate Hearst. So it all just depends on you. I did not like UWorld at all. Yeah, my NCLEX was not really like you were either. That's what I'm saying. I'll be doing Remar. Shout out to Remar. I like Remar. So I think that her stuff is great. So the answer is D, the mode of transmission. I keep wanting to say transportation. Before instituting isolation precaution, the nurse must first determine the organism's mode of transmission. For example, an organism transmitted through nasal secretion requires that the patient be kept in respiratory isolation, which involves keeping the patient in a private room with the doors closed, wearing a mask, a gown, and gloves when coming in direct contact with the patient. So, but I like Archer too. So, you said not D. Nope. The answer was A. If you think this is much info, you should be in nursing school, right? After you graduate, should you spend a long time a long time studying for NCLEX? You should spend adequate enough time. So you really want to start studying heavy for NCLEX anywhere from like a month to 3 months before you graduate. I'm using simple nursing, not too bad. How long do you recommend studying for the NCLEX? So I recommend studying for the NCLEX at a minimum 30 days, no more than 90 days. Some people study for 2 weeks, and that's just like right when they get out of school and the material is fresh. And that's what I mean, it depends on you and how you are. Everybody learns things differently, right? I didn't say too much info in regards to rationale. I was saying when it's time to answer when it is. Oh, well, you got to elaborate. Ma'am, you got to elaborate. Let me know. I failed NCLEX yesterday. We're sorry to hear that, but I'm going to ask you this question. What are you going to do about it? You have so many opportunities that are out there for you. So what are you going to do about it? And then think about why you failed. Like, did you not understand questions? Did you not understand rationales? What was your life like? Like environmental factors? You know what I'm saying? Like, did you put yourself on a schedule? You know, like what's your study plan? So on and so forth. Okay. Which is the correct procedure for collecting a sputum specimen for culture and sensitivity testing? Everybody's saying C. We got some D's. We got some A's. I'm trying to make sure I'm reading y'all's questions too. I do not listen to this, man. This is not like the NCLEX. I never said it was like the NCLEX. So who are you, sir? What you mean? I had a question like this. Look at that. So you got somebody coming in here acting a fool. Nurse Nelly, if you Nurse Nelly or Cass, if you don't mind, our gentleman, Mr. DB, needs a 600. I hear you, honey. I hear you. All right. So our answer is people are so hateful. It's okay. It doesn't bother. Hey, you want to know what's crazy? It's because I'm a nurse. I failed my exam 3 times and I know what people need. I'm not worried about that. You see what I'm saying? I'm here for y'all, for people that want to be positive, right? The answer is C. Have the patient, oh my God, expectorate. Oh my God. The sputum into a sterile container. Placing the specimen in a sterile container ensures that it will not be contaminated. A sputum specimen is obtained for culture to identify the microorganism responsible for lung infection, identifying cancer cells shed by lung tumors, or aid in the diagnosis and management of occupational lung diseases. The other answers are incorrect because they do not mention sterility and because aseptic mouthwash could destroy the organism to be cultured. That's the same thing. It's just like, hey, I want to draw for example, like if you're going to do a wound culture, you want to do a culture of the wound before you start antibiotics, not give antibiotics and then do the wound, because by that time there may not be nothing there. Right. So, was distracted by the stupid comment. No, don't worry about it. Don't y'all worry about no comment. Y'all gonna be distracted by people snoring and typing on keyboards and stuff when you go take your exam. We good. You didn't see the question? So here's the question again. Do you offer one-on-one tutoring? I do offer one-on-one tutoring. And actually, that might go away. I'm looking more to starting to do group coaching. And I'm actually going to start a trial run of group coaching starting on Sunday. I'm going to start with 5 people, and we're going to see how that goes. How many times can you take the NCLEX before you can't take it anymore and are kicked out? So it depends on your state, Michaela. In Texas, you have up to 4 years, and you have a lot of times to take it. I think New York, is unlimited. Florida, you have 3 times, depending on what state that you're in. Do you do these reviews often? I'm loving this. Megan, I do these every Monday, Wednesday, and Friday at 5:30 Texas time. You're welcome. Do you think you would help with fundamentals of nursing and health assessment nursing? So is it Rena? I specifically only do NCLEX review, like for RN and for LPN. Oh, Ohio is unlimited. Illinois, you're in Oklahoma. Ew, I'm just playing. Look, I'm a Longhorns fan, so I'm gonna say, Oklahoma, ew, all the time. Should someone wait and work med surge for experience before jumping into specialty? Jenny, it all just depends on you. You're welcome, Rena. Hey, go Horns. So, Jenny, that really does just depend on you specifically. If you want to go to a specialty, go ahead. If you don't know where you want to go, med surge is a great place to start. If you want to go to med surge, that's a great place to start. Go to med surge. Anyone know about Mississippi? It's a state. Boomer sooner. Ill, get out of here. All right. So, an autoclave is used to sterilize hospital supplies because what? More articles can be sterilized at a time. Steam causes less damage to the material. A lower temperature can be obtained, and pressurized steam penetrates the supplies better. Everybody's saying D, but everyone tells me I need med surge. No, you go to where you want. You don't need to go anywhere. You go to where you want, but you can go to med surge. Like if you don't know where you want to go to med surge. Like me, I knew I wanted to go to ICU. You couldn't tell me no different. And I went to ICU, and then I went to PACU, and now I'm in the OR. So it all just depends on you and where you want to go. Okay. All right. So I think everybody was saying D. Liza says D. Is it Kirsten? She said D. Is it Chrissy said D? You're welcome, Jenny. D. All right, cool. Let's see. So the answer, of course, is D. An autoclave, an apparatus that sterilizes equipment by means of high temperature pressurized steam, is used because it can destroy all forms of microorganisms, including spores. Autoclaves operate at high temperatures and pressure in order to kill why did it say microorganisms and spores? They are used to decontaminate certain biological waste and sterilize media, instruments, and labware. So I used to be a surgical tech. I was a surgical technologist. I'm still a surgical tech, been one for 13 years. I haven't done anything in regards to that since 2016. But this is like the bread and butter of being a surg tech, is knowing like about sterilizing instruments and stuff like that. All right, shout out to all 180 y'all. Appreciate y'all rocking with me. Hey, don't get distracted. Don't get distracted by people that come into the chat and that start doing stupid stuff like that. All right, don't be distracted by that, because we about this. And I ain't about one person coming up in here acting a fool. You see what I'm saying? That's why we got 600s, and I love them, right? So shout out to all y'all. Hey, if you're new here, welcome. My name is Kevin. Go by the Boot Nurse on all social media platforms. We're doing NCLEX questions. Okay. So one thing I want y'all to do is I want y'all to participate. I'm kind of sort of not really, but kind of sort of maybe really funny. I want to know who you are, where you're from, where you're at in your nursing journey. Taking your NCLEX. Have you taken it multiple times? Are you a brand new student? Are you in nursing school? Are you going to a long-term care facility, to go do your clinicals? Like, let us know where you are. If you're brand new, if you've already told me your story, you don't have to tell me that again. I already see y'all. Y'all are participating. Brooklyn, Marcy Projects. I'm sorry. I'm just playing. But shout out to y'all. Hey, that's what I want to know. Trying to foster a good environment down there. Hey, I like questions. I like likes. I like gifts, whatever. Hey, the more likes that you give me, the more questions that you give me. All right, I'm going to give you, but whatever, you do you. We have quite a bit of questions. So I want all of them. And by all of them, I want the likes. I'm saying I want all of them. Pharmacy, shout out to you. Hey, we need 10,000 followers. I need everybody to follow me. Shout out to all 98 of y'all. I need 98 people to follow me right now because you like me. You know what I'm saying? You like me. That's what I'm talking about. 7-day NCLEX course. I'll talk about that again. It's in its pre-launch phase. We're updating content. We're adding NGN stuff. All that stuff's coming. Everybody that's helping me build the plane as we're flying, whatever. We're going from Spirit Airlines to to Emirates Airlines. That's what I'm saying. That's how I like to say it. $48, one payment. That's it. Once you get it forever, and you get all the updates and whatever little perks I throw in there later on down the line. So make sure you guys check that out. If you're a brand new nursing student and you don't take NCLEX for like another year to 2 years, you'll have something there. Does it work for both RN and LPN? It does, because all the content is all relatively the same. But you as an LPN need to know what you can't do, who you can take and not take. When your patient goes from stable to unstable, you can no longer have them. what your tasks that you can do, such as you can do sterile procedures. You can't do PICC lines. You can't do, although you need to know blood and blood products, you can't administer blood, right? Those are the things you need to know. Biggest things. That's the biggest difference between being an RN and an LPN, okay? When it comes to studying for your exam. All right. And then also, hey, don't troll my chat. Don't come in here and be a fool. Obviously, certain people don't know to not come in here and act a fool. And you would think it would be a common courtesy thing, but they don't. So you act a fool, you get a 600. 600 is 600 seconds, which equals 10 minutes. And that's how long we're going to ban you. And by ban you, you're going to get you're gone. I just like saying 600. So if anybody's in here acting a fool and I don't see it, it's okay for you to drop a 600. You'd be like, hey, Kevin, 600. Nurse Nelly up in here love giving people 600. So don't try it. All right. I love y'all. Hey, and also don't gatekeep. I got these questions, nurseslab.com. These are like the older format of the NCLEX. However, these formats are still there. Although the multiple responses, the closed questions, and the case studies that are in there for the new NCLEX, your multiple choice questions are still in there as well. Okay. They're still in there. Yes, Lexi, it's free. Right. And also, if you're a brand new nursing student, or if you're a nursing student in school, this website is great for like nursing diagnosis and in whatever other little questions that you want to know in regards to nursing that, of course, if I don't get to it or somebody doesn't answer, you could just, scroll that page. OK, yeah. Hey, more likes, more follows, more questions. Love it. All right. On to the next one. All right. Question number 16. The best way to decrease the risk of transferring pathogens to a patient when removing contaminated gloves is to what? Is it wash the gloves before removing them? I'm laughing. I don't know why I'm laughing at that. Gently pull on the fingers of the gloves when removing them. Is it C, gently pull just the cuff and invert the gloves when removing them? Or is it D, remove the gloves and then turn them inside out? Somebody who just screamed at me said C. Oh, it was Michaela. Okay, I got you. All right. All right. Bree says C. Alicia says C. Megan says C. Hey, if I didn't answer your question or if Nurse Nelly didn't answer your question, you guys can drop them back in there. I'm trying to do both, trying to read the question, make sure you guys got everything going on. Invert C. Okay. Got C. We got C. Thank you. Is that Mackenzie? Shout out to Mackenzie for the follow. Hey, make sure you guys, if you guys don't follow me, make sure you guys follow. All right. Monica, appreciate the follow. Neighborhood nurse says C. This is a CNA question. Okay. Okay, we got C. Brittany just joined and follow. Appreciate you, Brittany. All right, here we go. I think we got a general consensus of, this right here. Just checked off my PPE and wash hands this week. Shout out to you, Lexi. Look at that. Out of curiosity, what are the sections of the NCLEX taking the MCAT tomorrow? So the sections of the NCLEX are management of care, pharmacology, physiological adaptation, psychosocial, reduction in risk, basic care and comfort, health and health promotions, and I'm drawing a blank on the last one. All right. Educator says D. All right, well, let's find out. And the answer was C. Turning the gloves inside out while removing them keeps the contaminants inside the gloves. They should then be placed in a plastic bag with soil dressings and discarded in a soiled linen room garbage pail. The other choices can spread the pathogens within the environment, and that's not what we want. What's this website? What are you talking about? Is it Botic? What you talking about? Is this for LPN or RN? This is for both. In case anybody was asking, shout out to everybody that just jumped into the live. We're doing NCLEX questions. Sterility has also confused me. What's up, Macy? Sterility will confuse you, right? Kevin is what? Kevin, is all your lives only for people who are taking the NCLEX? So mostly it's only for taking the NCLEX. But however, these questions are I have a whole bunch of nursing students that are in here, right? And I can tell you one thing that I wish would change is that they start doing NCLEX style questions, right? Like at least after fundamentals. And I mean, implementing them into the school. But, that's not my choice. What section of the NCLEX do you think is the largest section? Who is this for? I think it was for Michaela. So the largest sections on NCLEX are management of care, physiological adaptation, and pharmacology. That they make up 44 to 49% of the entire exam. Kim is a lawyer and a patient. I do this for fun. What? Brandy, what you talking about? I'm lost. This just got the good pop up. For you. Wait, what? This just popped up on my For You. Oh, okay. I got you, Megan. I got you. All right. I think we got a good understanding of this one. We can move on to the next question, right? Question 17. After having an IV line in place for 72 hours, a patient complains of tenderness, burning, and swelling. Assessment of the IV site reveals that it is warm and was it erythemus. This usually indicates what? Infection, infiltration, phlebitis, or bleeding. I always look. I'm not the best hooked on phonics person, but you know what I'm talking about. Y'all know what I'm talking about. Got an infection. Does anyone know if Archer is a good study resource? Yes, Rashida, it is. Infection. We got C, C, A, C, A, C, 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 C. Brittany says A. Shay says B. Phlebitis. Monica says A. We got some C. So we're bouncing between A and C, it looks like. We're bouncing between A and C. Infection would have oozing. Okay. Hey, so remember, don't add anything extra into the question, right? They didn't say it could, it does, but they gave you this, right? So we got C. We got Remar. Is that Regina? Regina Callion from Remar Nursing? That's not her. I know she's not in my live right now. I know you're not in my live right now. I talk about you all the time. I actually made a YouTube video about like one of the best like nursing podcasts and like nursing stuff. Regina. No, that's crazy. I talk about you all. We were actually just talking about what are good NCLEX reviews, and somebody was in here and said that yours was good. I was like, I like your stuff. I've seen your stuff before. I had a friend that used your stuff when it was on DVD. Oh man, hey, that's crazy. Now I feel famous. All right, here we go. Let's see what the answer is. So the answer is phlebitis. The answer is C. It is not infection. Tenderness, warmth, swelling, and in some instances, a burning sensation are signs and symptoms of phlebitis. Superficial phlebitis affects veins on the skin surface. The condition is rarely serious and, with proper care, usually resolves rapidly. Sometimes people with superficial phlebitis also get deep vein thrombosis, so a medical examination is necessary. So here's the thing. It's like, well, if we're thinking about, I am fangirling because I do follow her. I follow her for a lot of things. And she has these things called Motivational Mondays that if you guys don't follow her on Facebook, I'm just saying, I went to them all the time when I failed my NCLEX. I'm just saying. But anyways, so one thing to think about when we're talking about like sometimes people with superficial phlebitis also get deep vein thrombosis. You know, like what could that lead to? A DVT could lead to what? I need to stop changing answers. Ma'am, stick with is that Don the Beat? Stick with your first answer all the time. Never. Yes. Pulmonary embolism. That's what I'm talking about. Right. So now this is where the critical thinking comes into play. They're like, oh man, what is a deep vein thrombosis? Oh, that's a clot. Oh, okay. What can that cause? Oh, okay. And then if you have a patient who it's what we call throw a PE, then what do? You're like, well, might as well just hit that code button because they're gonna stop breathing on you. So it's essentially clot, go into lung, suffocate. And when you, I'm telling you, the first time you see somebody throw a PE, it is going to scar you for life because you're going to hear it and see it. And they're going to get as white. Well, I can see it. It's white, but they're going to get as white as the back of this damn PowerPoint. All right. So there's that. Yeah, death for sure. Laugh out loud. I don't know why I feel the need to respond to every little question. That's okay. That's what this is for. Barely in my second week of nursing school. Monica, it's okay. Y'all so nice. Lexi, that's what we about. That's what we all about doing up in here. So, here we go. Oh, I'm sorry. Did everybody understand that, right? Everybody understand the difference? And also when you read, because there was a bunch of people that picked between C and A, right? Read your rationales. Read on why it's right. You don't have to agree with it. You don't have to agree with it. It's not about if you agree with it. It's about what's right. All right. So when you read it, you see why this answer is right. And then you see why these were incorrect based off of the question that was asked you. Okay. 2 weeks left for me. Shout out to you. Is it Shani? Shout out to you. Shout out to you. Appreciate all the follows. Make sure you guys share. We're going to the next one. Question number 18. To ensure homogenization when dilating powdered medications in a vial, the nurse should what? Shake the vial vigorously, roll the vial gently between the palms, Birdman style. Y'all know what I'm talking about. Invert the vial and let it stand for 1 minute or do nothing after adding the solution to the vial. Beep. Roll. Amanda says roll. Okay. Hey, I'm just saying, if you never remember, just like, hey, like I think Nicki Minaj said it. Rub the vial like Birdman. I taught somebody that one time and they never forgot. I was like, oh, I know when I reconstitute medication, I'm just like, you roll it in them hands. All right, roll it in them hands. So we got everybody saying B. I haven't seen anybody say anything different. Hey, I know if I'm going too fast, let me know. I know y'all get mad because I'm going too slow, but I want to give everybody the chance to answer. All right. So shout out to all y'all. Shout out to all the love. Hey, appreciate the likes. Make sure you guys follow because I'm trying to be unghetto to where I ain't got to do it like this. You know what I'm saying? I don't usually do lives. I just have to make funny content. I'm not the teacher like Kevin. That's true. She does make really good content. Hey, if y'all aren't following Nurse Nelly right now, y'all need to go over there and follow her. I'm trying to let y'all know, trying to change our lives, let y'all know what it is like out here in this nursing world. All right. So I think we got enough time. Let's answer this question. Here we go. So the answer, of course, is roll that vial gently between them palms like Birdman. Oh, gently rolling a sealed vial between the palms produces significant heat to enhance dissolution of the powdered medication. There is no specific time. You just got to look at it. Like you'll know it's like once it doesn't have chunks in it. And then once the solution is all the way dissolved, like you won't see like any particles or anything like that, right? Not the Birdman. I'm trying to tell you, look, you gonna remember it. You're gonna remember it. Watch when you're trying to reconstitute something. You're like, here we go, Birdman, until it's thoroughly mixed. That's right. Yes, ma'am. That's exactly what it's like. All right. And so here's another thing. And I know I always talk about redondavant, right? So when she got in trouble, when she gave a person, was it a vecuronium? Vecuronium is in a powdered form and you have to mix it in with a solution to dilute it, right? To turn it into a liquid. I'm telling you, once you figure that out, you'll never forget it. All right. On to the next question. All right. Shout out to all 89 of y'all up in here. Appreciate all the likes. Appreciate all the likes, all the love. All right. Here we go. The nurse is teaching a patient to prepare a syringe with 40 units of NPH insulin for self-injection. The patient's first priority concerning self-injection in this situation is to what? Remember, we're doing first, systematic, right? 1, 2, 3, 4, not an accumulation like, let me pick the best one out of the 4. I need to know what number 1 is. Do I assess the ejection site? Select the appropriate ejection site. Check the syringe to verify that the nurse has removed the prescribed insulin dosage or clean the injection site in a circular manner with an alcohol sponge. We got C. We got C's. Somebody said D up in here. Chrissy said D. Okay, I was gonna make sure I didn't want to say that. You're also supposed to roll nail polish. Look, man, we ain't rolling nail polish up in here. Monica says D. Michaela says C. Aaliyah says D. Okay, that's my niece's name. All right, what else we got? Thank you for the follow, Rebecca. Letitia, thank you for the follow. B, C. What was it? B-A. Lindsay says B-A-C-D. Ma'am, it's not in order. Are you telling me which one is it? Are you telling me? Miss Scott. Miss Scott. I'm just going to call you Miss Scott. She says C. Life says D. Lexi says wait. What you mean wait? What am I waiting for? Justine says A. Oh, no, Justine says C. I'm sorry. Lexi says assess. Assess what? What are we assessing? You're asking me, are we assessing? Right? So based off of your question, think about it. The nurse is teaching a patient to prepare a syringe, right? So I want to teach my patient to prepare a syringe with 40 units of NPH insulin for self-injection, right? The patient's first priority concerning insulin concerning the self-injection situation should be what? C, make sure you pull the correct amount. Okay. Assess the site. Okay. So we got to think, what is the matter of importance here? Think about it. What is the medication that we're giving? Make sure it's correct. C, what is the medication that we're giving? Everybody's saying C. You want to verify before doing anything first. Because think about it. What is the medication that we're giving? Remember, it's the very first thing before you do anything. Right? So Mackenzie says B. Okay. I got you. I think D. Okay, Sling. NPH insulin. Okay. So what does insulin do, Lexi? What does insulin do? I know people want me to go on to the answer, but now Lexi's asking these questions. Know your rights of medication administration. Okay. I think it's D or B. Okay, Joanna. Joanna, you've been here the whole time? Lowers blood sugar, right? Right medication, right? Lowers blood sugar, right? What happens if I give too much? Verify all medications first. There you go. Helps. There you go. There you go. Regulates blood sugar. Okay. So these are the questions you have to ask yourself. It's not what ifs or whatever. Whoa, who said hyperglycemia? Megan, you said hyperglycemia? I need for you to elaborate. For me. Hypo. My bad. All right, cool. All right. So, but these are the questions you have to ask yourself when you see these, right? Because you're like, I need to assess the site first. Okay. Do you? Why don't you become a nurse professor? Chris, what you think I'm trying to do out here? All right, answer. The answer is C. Check the syringe to verify that the nurse has removed the prescribed insulin dose. When the nurse teaches the patient to prepare an insulin injection, the patient's first priority is to validate the dose accuracy. The next step is to select the site, assess the site, then clean the site with an alcohol injection. So, and why do we want to make sure we have the right insulin, the right amount? It is safety. The nursing exam, NCLEX, either RN or PN, is all about nurse safety. What to do, what not to do, when to give something, when not to give something, right? What are the signs and symptoms, right? Insulin is a high risk medication, is it not? And it lowers your blood sugar. You'd be surprised. And this is no shade on nobody, but it lowers your blood sugar. Some people are like, oh, it raises it. I'm like, you sure about that? You sure about that? That's what I do to people now. I do it sarcastically, but I'm being very serious. And I'm going to tell you why. When I was a nursing student, I pulled up 20 units. I pulled up 20 units of like Lispro, and I literally could have fucking just killed somebody, right? And so that is why it is important that you pay attention. Luckily, my preceptor like didn't punch me in the face, but luckily I showed her, I was like, here, this is the amount, right? She's just like, oh, honey, you're trying to kill him? And I was just like, no. And she was just like, well, let's look at the order again. And I'm like, okay. Wonderful woman, will never forget it. And now when I give insulin or any medication, I will walk around and find a nurse. I was like, hey, is this right? I was like, hey, so I'm giving 2 units. Is that 2 units? And they're just like, yes. And I'm just like, okay, thank God. And then I write and then I document it and I go on by my day. I'm so scared of insulin. Don't be scared of insulin. You just have to be prepared. That was a lot for Lispro. Yes, Chrissy, that is a lot for Lispro. That's a lot. Hey, so here's a question. What if you give too much insulin? And then your patient becomes, lethargic and incoherent and they're A&O times 1. Then what are you going to do? Apple juice. I just said that they're unconscious. I said that they're unconscious. Savage sauce. Glucagon, right? Yeah. What if I have IV access? Yeah, dextrose. There you go. Dextrose. D50. Shout out to, hey, if you've ever pushed D50, it's literally like pushing just pure like sap through a syringe. Yes, it is. It is very hard. Very, very hard. Okay. So this is where your critical thinking, clinical judgment, I'm going to say it all the time. Your critical thinking and your clinical judgment happens like that. You have to know how these things happen. That wasn't the question, but y'all were able to spit out the answer and I love it. All right. Molasses. That's right. I've had people take that amount, but most definitely double check. Yeah. So you can have patients that'll take 20 units, right? Depends on how high their insulin is. So, we could talk about endocrinology all we want right now, but we ain't doing that. We're going over these questions. So shout out to y'all. Here, next question. The physician's order 1 gram of cefazolin or Ancef and 150 mils of a normal saline solution in 60 minutes, right? What is the flow rate if the drop factor is 10 drops per 1 ml? What's ANSEF? ANSEF is an antibiotic. Most time ANSEF is given preoperatively as a broad spectrum antibiotic for patients that are having a surgical procedure. Okay, Edith, that answer was for you. When are situations dextrose is given? When you have somebody who has hypoglycemia, Lexi. So remember, with hypoglycemia, depending on what literature you're looking at and depending on what school, some places will say 70 and below, or some places will say 60 and below, right? But if you have somebody who's like 40 or 30, or they're talking to you, they're like, right? You might want to think about giving them some D50, right? If they're conscious, you can give them what we call rapidly metabolizable carbohydrates, right? Such as juice. Doesn't have to be orange juice, just juice. Could be candy, could be like turkey, something that they can eat really quick to bring their blood sugar back up, right? That's a really big thing between type 1 and type 2 diabetics. Okay. Shay says A. Edith says A. I'm trying to answer everybody's question. Shout out to everybody for participating with IV access. I need to go back to studying. Are you live every night? No, I'm live Monday, Wednesday, Fridays. Everybody wants me to go live every night. Hey, put it this way. I could go live every night, but I'm not gonna. Just not right now, because, I can literally do this all day. I love teaching. JC says 5 times 10 divided by 60. Okay. So we got A. A lot of people are saying A. Okay. So 25 drops per minute. I love dosage calculations. I don't. Me and math don't math like that. I thought the new generation didn't have math no more. You thought wrong, Crystal. You thought wrong. Dosage calculation is a part of pharmacology. It ain't going nowhere. I didn't mean to sound sassy. I'm just being completely honest. Can't go live every night. Yeah, Nurse Nelly can't go live every night. Can I recruit you as an instructor? Michaela, look, you or everybody else is just like, can you be my instructor? You're a strict teacher. Nina, I am a very assertive teacher. I am a very strict teacher, but I mean, it comes, I promise you, from nothing but a good place, nothing but a good place. So is this a conversion factor? Yeah. So this is where you do your conversion, right? Galen College of Nursing needs you. Look, Mackenzie, what Galen do you go to, Mackenzie? You are direct, which is helpful. Yeah, I am very direct, right? And I'll tell you, hey, you know what? I'm not sure. Let's go find that answer. If you have an instructor that has all the answers, maybe they're full of shit. I'm just saying, maybe they're full of shit, because not everybody knows everything. And that's okay. That's okay if you don't know everything, right? This is the first time I've been in one of your lives. Do you take requests for topics? I have. That's the only reason. This is a fundamentals set of questions. As a matter of fact, let's answer this question right now. So the answer is A, 25 per minute. When you have an order for an IV infusion, it is the nurse's responsibility to make sure that the fluid will infuse at the prescribed rate. The IV fluid may be infused by gravity using a manual roller clamp or dial a fuse, or an infusion pump. Hey, so here's a question. Can we give potassium in a manual roller clamp, or do we give it in IV infusion pumps? I'm going to Galen 2 in Houston. Infusion pumps. Nurse Nelly, you already know the answer. Can you give potassium with a manual IV clamp or dial up flow, or is it with an infusion pump? Only an infusion pump. Hey, what's going to happen if you give somebody too much potassium? What's going to happen? What's going to happen? Hey, I don't know. Yeah, they're going to code. Hey, I don't know if anybody saw my post that I made. Yeah, cardiac. I don't know if anybody saw the post that I made where it was the code blue sound. That's pretty much what's going to happen. I don't know if that brought anybody into my live. But let me tell you, when the first time I ever heard that, somebody sent it to me and I was triggered. I was like, oh my God, I had to go sit in the shower, scrub myself and cry, because code blues will do that to you. If people were to take the NCLEX same day, Would they get a totally different question? So the NCLEX is what we call a computer. It's on a computer adaptive test. Nobody is going to get the same. You may get the same question, but the test is completely regulated by how you answer your previous question. Okay. That's how it's done. It's on a computer adaptive test. So if you answer the question correctly, it'll give you a harder question. Don't know what that harder question is going to be. If you answer it incorrectly, it's going to give you an easy question. Okay. All right. Hey, what question was that? What question? That was question 20. Hey, here we are. Hey, shout out to all 136 of y'all. I appreciate y'all for being here. My name is Kevin. I go by the Boot Nurse on all social media platforms. Hey, right now we're doing NCLEX style questions, or we're doing NCLEX questions. This is specifically over fundamentals. This was per request from the last live that I did. Make sure you guys participate. All right. I'm kind of sort of, but not really, but really funny. All right. I enjoy every time I join, I get on the break. Look, that's not my fault. What you mean? You better get here early. So, hey, we're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. OK, I want to know, are you taking NCLEX? Have you taken NCLEX? If those that don't know what NCLEX is, you're probably not there yet. And that's your licensing exam if you're preparing for it. I want to know if you're a pre-nursing student. Hell, I've had some med students in here, some psych students, some pharmacology students. I love how everybody jumps up in here. I'm all for it. I'm all for it. All right. I want to know those things. OK, hey, the more likes that you give me, the more questions that you give me, or the more likes that you give me, the more questions I give. But hey, whatever, you do you. We do have a limited amount of questions because, I can't be on live for hours on end. As much as y'all want me, I can't do that because, your boy got things he has to do. Got a lot of questions. You know what I'm saying? So we've already gone through 20. I want all the likes. I want all of them, not some of them, not a few of them. I want all of them. All right. So down there, we got Nurse Nelly, Nurse Cass. They are my moderators. They are what makes this thing roll. Nurse Nelly's been a nurse for 4 years, worked in ICU, worked med-surg, tele, and now she does case management, loving her life. Nurse Cass has been a nurse for 17 years, going on 18, does corrections and does psych. She will fight you. Try Jesus, not her. Okay. So just letting y'all know that, hey, we need 10,000 followers. And I say we, as in you and me, you and I. You see what I'm saying? We need that. We need that. That way I can stream on the computer instead of on my phone because this is ghetto. You feel me? So I'm just letting y'all know what's up. The 7-day NCLEX course. Yes, I created an NCLEX course and it's in its pre-launch phase right now. The link is in the bio. It's for $48, which is 80% off of its regular price. OK, because we're going from Spirit and Frontier to Emirates Airline, baby. That's what we're doing. OK, so make sure you guys share this. Make sure you guys go over there. The link is in my bio. Make sure you check it out if it fits you. If you're a nursing student and you graduate in the next 6 months and you want an NCLEX course, boom. Go over there and look at it for $48. You have it forever. If you just started school and you don't graduate for another year or 2 years, I mean, it's a huge flex to go to somebody and be like, hey, I bought an NCLEX course for $48. I don't know about you. You know what I'm saying? I don't know if Regina's still in here, but she got a course over there too. Y'all can go check that out as well. But anyways, shout out to y'all. Go check that out if it fits for you. Hey, don't troll my chat. Okay. If you troll my chat, you're going to get blocked. That's all I'm going to say. Also, I don't gatekeep. I got these questions from nurselabs.com. So they have a bunch of stuff over there. These are the older types of questions, but even though they're the older type of questions, these can get the brain churning. We got nurses in here and people who just took their NCLEX and people that are in nursing school that are getting stumped on what some people would consider easy questions. Okay. So I'm just saying, be flexible. We're having a good time. We're getting into the questions, but better something than nothing. Okay. Better something than nothing. Whatever questions you guys have, answer them down in the bottom or ask them down the bottom. We rolling. All right. A patient must receive 50 units of Humulin regular insulin. The label reads 100 units per ml. How many milliliters should the nurse administer? Here goes another dosage calculation question, right? We have 0.5 ml, 0.75 ml, 1 ml, or 2 ml. We got I'm just going to start my prereq. Shout out to you. I kind of want to go up to see what everybody said. Nola said you're so encouraging. Shout out. Hey, I appreciate it. This is what I'm here for. School is very good with communicating what to do when we graduate, but not what to do while you are in it. Yeah, that's kind of how they go. Graduate in 2025. Shout out to you, Jen. I've been wanting to go into nursing after my medical assistant for years. Nola, you should just do it. Don't tell me what you want to do. You should make it happen. Where do you recommend for new grads to start? No. So Nurse Nelly, no, will tell you to go to MedSurg, right? I tell you to go to where you want to go. You want to go to ICU? You want to go to labor and delivery? You want to go to OR? You want to go to PACU? You want to go to, surgical? You go wherever you want. There are certain places that you need to go to in order to get, like, if you want to be a nurse practitioner, you have to have at least a year of working as a nurse. If you want to go to the ER, do that. You can do that. You want to go to the OR, Jen? Make it happen. You could do that. I ain't in nursing, but I know my math. Look, some people don't know their math, and some people's math ain't math, and I can tell you I am one of them. But however, learning is learning, right? I'm a nurse tech down there, and I love it. Where? In the ER? Alexa says A. Heard you, sir. I got you. All right, cool. Sorry, I went back up and I looked. Megan said, thank you. Go to where you want to go. But if you want to mix, go to the ER or MedSurg. Yep. No, you want to, PACU, tracking. Gotcha. Michaela says A. All right, cool. I think we're kind of all over the place. A bunch of people have said what they wanted to say. I've been in the P since I graduated high school, and I'm saying when I become it. Oh, okay. I'm tracking. I got you, Sauce. I got you. 0.5 mLs. I can't see the whole question. That's the whole question. That is the whole question right there. All right. We say A, graduate in 24. Shout out to you. Here we go. And the answer is A, 0.5 mLs. There are three primary methods to calculation of medication dosage. You got dimensional analysis, ratio, proportions, and formula or desired over half method. Desired over half or formula method uses a formula or equation to solve for the unknown quantity, which is X, that much like ratio proportions. All right. Hey, so dimensional analysis is really good. Desired over half was a really good one. That's the one that I learned first. So, hey, I can tell you right now, on my NCLEX exam, I had 2. No, I didn't have any on my last exam, but my first 3, I had 2 on each of them. If you're a nursing student right now, when you get to dosage calculations, a lot of the schools will require you to get 100. So when you get to dosage calculations, especially for pharmacology, you better know your medication front to back. You better know your calculations front to back. You have to know them, because I've seen people fail out, and it's considered to be simple math, but sometimes numbers really, really, really trip people up. Yeah. So Jen says, my school requires 100. I understand, was that desired over half? My school required a 90 plus. My school required a 90, 1.5. Yep. Mine's required a 90. My school required a 93 and up. So I'm just saying, you got to get them down. We have this every semester. Must pass. That's a must pass. They ain't playing with y'all. They ain't playing. All right. Here we go. Question number 22. How should the nurse prepare an injection for a patient who takes both regular and NPH insulin? Draw up the NPH insulin, then the regular insulin in the same syringe. Draw up the regular insulin, then the NPH insulin in the same syringe. Use 2 separate syringes. Check with the physician. C. Okay. B. The queen. The queen says B. Mayhem says C. Am I going to do weight dosage by any chance? I'm not. We're not doing those at all. At least not right now. B, C. So we're kind of between B and C. Tina says B. KJ says B. Audrey, not Aubrey, says B. Okay. Lions Den says D. Okay. Okay, we say B. B. Christopher says B. Clear before cloudy. Okay. Got B. Okay. Got a bunch of people that are answering. Hey, shout out to all 125 of y'all in here. Hey, make sure you guys follow. We need 10,000 folks. 10,000 folks to hang out, so I can start streaming from the computer, so I don't have to be ghetto. All right. If in doubt, ask the prescribing physician. Well, yeah, when in doubt, but I can tell you right now, that ain't the answer. I see. You see what, Joanna? I think the only insulin that can't be mixed is Glargine, but I could be wrong. You could be. Was told you're an RN before NPH and they go together. Okay. All right, cool. Got everybody that answered the question a little bit. So what we'll do is we'll answer the question. And the answer is B. Draw up the regular insulin, then the NPH insulin in the same syringe. Drugs that are compatible may be mixed together in one syringe. In the case of insulin, the short-acting, which is the clear insulin, the regular, should be drawn up before the long-acting or the longer-acting, which is the cloudy insulin, which is NPH, to ensure accurate measurements. I'm going to tell you guys, yes, the goal is RN. So just like somebody said, if you don't remember, he was just like, for everybody's goal should be to become an RN, right? So here's one thing I heard. It was just like, what are you trying to become? And then you say, I'm an RN. I'm trying to become an RN. They'll be like, all right, cool. So act like it. So you want to drop the regular first, then the NPH. Or clear, which is regular, and then cloudy with NPH. Okay. So if you can't remember clear before cloudy, then you could just remember, I want to be an RN. So I want to drop my regular insulin first, then my NPH. Does that make sense? Was that helpful? If not, tell me to go kick rocks and tell me to go away with myself. I don't know yet. Let me pass it. I got you. That's why I did this. I was just like, okay, that's why I did that. All right. Was that Sharon? Sharon said yes. Okay. Chrissy said very helpful. All right, cool. Hey, as long as it's helpful, just another tool you can put in your toolbox. That's what helped me remember it at first. Okay, Tay. Yes, I have an exam next week on glucose. Mnemonics helped me so much. Okay. That's a good one too. Another one, if you like mnemonics, Lexi, is Picmonic. They're pretty good too. I actually am sponsored by them. So they're a brand. I'm a brand partner with them. So they're pretty good too. That's helpful. I'm glad that's helpful. All right, cool. On to the next question. Avery, where have you been? I don't know where you live, but we've been doing this for a while already. So I'm just saying. All right. Here is question number 23. Love that you shout out other platforms. Look, I don't got no. Hey, I want everybody out here. I want all 126 of y'all to know that I want everybody out here to eat, even if it ain't at my table. Right. So for if you hear other people shitting on other people's stuff, like that's an issue. That is an issue. Right. Because what may be good for one person may not be good for the other. That's why, like me, I don't like ATI, but somebody else might like ATI. Same with Hesse. I didn't like UWorld, but I still tell people, hey, UWorld is an option. I mean, I like Archer. I do like Archer, but it may not be an option for somebody. For me, it was Kaplan and Mark Klimic that worked. For you, it could be Hearst and UWorld, whatever combination. You see what I'm saying? Think about that. All right. A patient has just received 30 milligrams of codeine by mouth for pain. 5 minutes later, he vomits. What should the nurse do first? Remember, 1, 2, 3, and 4. What's the first thing that we're doing? Call the physician, remedicate the patient, observe the emesis, explain to the patient that she or he can do nothing to help them. Well, I can tell you right now, we definitely know which one, right? So check the patient, then notify the physician. Okay. We got C, we got A. Chrissy says C. Shay says C. Okay. All right. Okay. All right. I'm not sure. Well, hell, hold on. AdPie, it says, Nikki says, I'm not a nurse. What's an emesis for extra credit? Emesis is vomit. Like it's your actual vomit. Right? Avery says real vomiting. Yep. So we all got C. Oh, some people are saying A. Okay. All right. Somebody said AdPie, assess and then call the doctor. Okay. You could do that as well. Let's see what the answer is. We about to see what. Shout out to all 226 y'all. Hey, thank you so for the follow. Hey, we need people. Hey, I need all y'all to follow me. We need 10,000 people to follow. What's that? Is it Tasia? Lex says C. Okay. Shout out to all y'all. Appreciate all the follows. Sierra. Is that Sierra? Thank you. Is it Sadie? Thank you. Macy. Thank you. All right, here we go. Here's the answer. The answer is C. Who said AdPie up in here? Who said AdPie? I love watching this live. Oh, hell, I missed it. I love watching this live. I learned so much. Not sure what I'll ever do with this info. You never know. You never know what you'll do with this info. Hey, yeah, that's what I thought. I thought you did say that, Miss Williams. So shout out to you. Thank you for your live. Michelle, I appreciate you being here. I love doing these lives. If y'all didn't like them, I wouldn't do them. I'm lying. I'd still do them anyway. So the answer was C. All right. After a patient has vomited, the nurse must inspect the emesis to document the color, consistency, and amount. What if there was blood in there? Because now, if there's blood in there, now we got a whole nother problem. Hey, if there was blood in somebody's vomit, right? What lab would we draw? And in the lab, what would I be looking for, right? Nausea and vomiting is another was a commonly seen adverse effect that is expected to diminish the following days or weeks of continued codeine exposure. ABG or ABGs, ACG, CBC is what we draw, right? GI bleed is what we're looking, could be potential, right? What happens after you observe if there's nothing sus in there? Are you asking me? H&H, CBC, right? Hematocrit hemoglobin, any CCRN questions? Desi, these are not CCRN questions. These are NCLEX questions. Michelle said, Professor Kevin G, he's going to be the next Mark K. Look, if I can meet Mark K before, he expires, because he is a very, very advancedly aged man, that would be great. The lavender tube. I love the lavender tube. Shout out to you. Oh, my goodness. But yeah, we're going to be thinking about no, he did not. He retired in 2021. He better not have died. I'm going to be mad. Somebody else came in my chat and said that he died, and I was mad. It was the fact that he retired. All right. No, he didn't. Hey, don't do that to me. Because now I'm going to strive for something more. All right, here we go. So, so think about the trends. Like, hey, if I have a patient that's throwing up and then there's blood in there. Okay. Oh, now I'm thinking about something different, right? Not ascites, but we're talking about, GI bleeding and all that other good stuff, right? Now I'm like, all right, well, let me see what their liver looks like. Are they an alcoholic? Are they jaundice? Now, what other issues do I have, right? Like, what's their liver look like? What if their freaking ammonia levels were up and they were also having GI bleeding? Like, what else could that tell me? You see what I'm saying? Those are the things that you have to think about. All right. Shout out to all 131 of y'all in here rocking with me. All right. So here we go. Question 24. A patient is catheterized with a number 16 indwelling catheter, Foley catheter, to determine if trauma has occurred. His 24-hour output is adequate. He has a UTI, or residual urine remains in the bladder after voiding. AKI, yeah. Let's see. AKI. What else? Megan says B. No says B, question mark. We got the Queen says D. Martin says D. Creation says B. Desi says D. Hope D. D. I'm trying to say y'all, there's so many of y'all and very little of me. So I'm trying. What is S? What is S? I don't even know. Phew, I'm all caught up. Michaela says D. JC says B. JC says B. Am I late? I don't know. We're about to find out. Typo? Okay, I got you. B. You can't use a bladder scan for residuals. Okay. Thanks, Phoenix, for the follow. Shout out to all 172 of y'all up in here. Shout out to all 172. What's number 16? It's the size of the French. So the number 16 is the size of the Foley catheter itself, right? So the bigger the number, the bigger the... So let's see as an example. Oh, here we go. Hey, shout out to the beeswax, right? So the tip of this, see how big this is? This is what we call essentially the French, right? So this is the size of the actual catheter. And this is what goes through the urethra into your bladder, right? So we'll say this is a 16, and we'll say this right here is a smaller one. So we'll say like a 14 or a 12. The bigger the number, the bigger the French. The smaller the number, the smaller the French. In regards to Foley catheters. Lexi, salute to you. Salute. Determined just K. Wow. Okay, we're ignoring you, ma'am. Lord have mercy. The answer is B. Okay. All right, well, let's see what the answer is. I don't know what's happening here, but we'll turn. All right, B, right. I want to ensure output. Okay. All right. And the answer, of course, is B. A 24-hour urine output of less than 500 mLs in an adult is considered inadequate and may indicate kidney failure. Like somebody said in here earlier, AKI, right? This must be corrected while the patient is in an acute stage so that adequate fluids, electrolytes, and medications can be administered and excreted. Indwelling catheterization is not needed to diagnose trauma, a UTI, or residual urine. Woo! Shout out to you, Avery. How long would straight cath be in? A straight cath does exactly what it says. It goes in and it comes out. So a straight catheter is what we call an in and out, right? The indwelling catheter does exactly what it says. It indwells, it stays, right? And it can stay up to a significant amount of time. After a specific amount of time of them having an indwelling catheter, they can get what is called a suprapubic catheter. And that's one that can actually stay in a lot longer, right? So if you've ever worked in a long-term care facility, or if you've worked in a nursing home or a STRIC or not STRIC, I'm sorry, or a STRAC or whatever, or an LTAC, yeah, that's what they do. Like they'll have catheters that'll be in there for a while. I don't like this question because you can measure urinary output without a catheter. Well, Martin, it doesn't matter if you like the question or not. This is the question that's given to you. When you start studying for NCLEX, if you haven't, even when you're in nursing school, you're not going to like the question, but that's it. And you're right. There are multiple ways to measure the urinary output. However, this patient is in an acute kidney injury. What are they excreting? What are they giving to you? Right? They're in an acute kidney injury. That lemon ain't squeezing out nothing. So I need to have an indwelling catheter in there because when I start rehydrating this patient, or if I start giving medications to take them out of whatever metabolic acidosis that they're in, I need to know what the urine output is to let me know like fluid regulation. Does that make sense? 24 hours, right? How often do you do these? Is it Cambria? I do them every Monday, Wednesday, and Friday. I looked right over an indwelling focus on the size. Look at you. Look at you. They could be incontinent. They could be. So does size correlate with the size with the catheter type? No, the size depends. The size is the size of the catheter. It doesn't. So you can have straight catheters that are 16 French or 12. You know. No, yeah, just for fun. They make French the opposite gauges. What do you mean? They made French the opposite of gauge. Yeah. My mom is geeking out over this live. We love study material. Hey, shout out to your mom. Hey, as a matter of fact, your mom should just come here and just be our friend and just tell her to just like everything and, not just like everything, but follow me so we can be unghetto. Why does the catheter have to be so big? So to be honest, that's normal. That's the normal size. I just use this as an example. Now, the catheters can be smaller because we'll say for men, for example, let's say you meet resistance at a 16 French. That's too big, right? If I'm meeting resistance, the last thing that I want to do with a big type of French of a catheter is push into the urethra, right? Because what if they have like fissures, or what if they have a prostate enlarged? They have an enlarged prostate, right? So I don't want to force that. So the smaller the French, the easier that it could get around into the bladder, right? Does that make sense? I get it. The question doesn't say anything about kidney failure, though. You're right. It doesn't say anything about kidney failure. However, it says a patient is catheterized with a 16 French indwelling catheter to determine what? That trauma has occurred. You're going to know if a trauma has occurred regardless, right? Has a urinary tract infection. That doesn't, like a catheter doesn't determine if you have a UTI. Labs determine that. Residual urine remains in the bladder after voiding. They don't need to void because they have an indwelling catheter. They're going to feel like they have to go to the bathroom anyway. His 24-hour output is adequate. This is the most accurate way. Keyword is accurate, is to have an indwelling catheter because there's not going to be any residual. It's coming straight from bladder into bag. Does that make sense? I know it sounds like I'm yelling. I promise you I'm not. But this is where your critical thinking has to go into play. Okay? That's where your critical thinking has to go into play. You need a cool cow, however you spell it, for boys. Haven't gone over none of this in school yet so far. Hey, look, now you're about to be ahead of the game. Now, Lexi, now you're about to be ahead of the game. All right. Question number 25. A staff nurse who is promoted to assistant nurse manager may feel uncomfortable initially when supervising her former peers. And we're going to talk about this one in detail afterwards. She can best decrease this discomfort by writing down all assignments, making changes after evaluating the situation and having discussions with the staff, telling the staff nurses that she is making changes to benefit their performance, or D, evaluating the clinical performance of each staff nurse in a private conference. What do? Keep smashing that like button, y'all. Keep smashing it. Avery says B. I would say B. All right, no, I got you. JC says B. Michaela says B. Brooke says B. What else we got? What else we got? Thank you for the follow, Queen. I appreciate you. Shout out to every B for real. Are you sure? B for real. Alyssa says D. Is it say Moto Mommy? Moto Mommy says D. Hopefully I said that right. Alicia says B. Okay. What else we thinking? What is it? Gotta love me. Nye. You with the face. It says D. Okay. Miss Carrie says B. Upon says B. Shar says E. What? You say what? That ain't even on there. Elena says D. B. Alo says B. Okay. All right. Shout out to all 210 of y'all in here. Hey, make sure you guys follow. I need everybody to follow me. Follow me. All right. I think, sorry, I'm on a call. I have to take a patient call. No, you're good. You're good. All right. We got some B's. I think we have a general consensus of everybody that's in here that is answering. I'm trying to give everybody ample time to answer before I go to the answer, before y'all start yelling at me, and then I'm going to be mad. I won't be mad. I'll just be sad and I'll cry over here. Cool says B. Okay. So we got a lot of B's. We got a lot of B's in here. All right. So I'm going to go to the answer. All right. In 3, 2, 1. Listen, did you guys know that the combat jail girl is getting a divorce from her husband because of whatever's going on with some girl who does OnlyFans? Now you do. All right. Oh, I'm so petty. Here we go. Answer is B. Oh my God. All right, here we go. Making changes after evaluating the situation and having discussions with the staff. All right. Hey, I love that dude, by the way. He's funny. A new assistant nurse manager should not make changes until she has had a chance to evaluate staff members, patients, and physicians. Changes must be planned thoroughly and should be based on a need to improve conditions, not just for the sake of change. What? I'm not trying to be messy. That shit is funny. And it's really funny how people can just go on the internet and just be like, girl, like, I can't believe he did that to y'all. Like, bro, y'all don't know nothing about their life. Shut the hell up. Anyways, that's just me, though. So please put a timer and stick to it. I love questions. I just don't like waiting. Look, I'm sorry. Hey, if you don't like waiting, you better tell that to all the other 184 people in here that are trying to look. So I'm just trying to give people ample time. Ma'am, Julie, respectfully, we are not on your time. I'm just keeping it a stack. All right. No. We're good. Lexi, you've been waiting to say that all night, huh? All right. Unfortunately, everybody, that is it for today. Timers make me feel pressure. Well, we don't want to give you guys pressure. I mean, look, I can put some pressure on, but we won't do that. We won't put the pressure on y'all. Not like that. All right. But anyways, that's it, y'all. That's it. What days do you do this again? I do that Monday, Wednesday, Fridays at 5:30. Joanna, ma'am, that is it. That is it for the day. That's it. That is it. I'm sorry. So, timer's done. Let us talk it though. Timer's okay. All right. Oh, dialysis for days. 5:30 Central Texas time. Taylor Boo, Texas time. Thanks for your time, Joanna. I appreciate you. Awesome questions. Thank you. You guys are welcome. Hey, I appreciate everybody. Hey, I love that you guys participated. I really do. I love all the likes. That's its own thing, but I really appreciate you guys being here and participating. I'm not in an actual teaching environment like I used to be when I was up on the podium teaching in classes. So this is as close as I can get to it right now. All right. So make sure you guys, keep liking. Hey, make sure you guys follow. That's the most important thing that I need right now is to follow so I can stream from here and y'all can see me as I'm talking and as I'm facilitating. You know what I mean? If you guys want to check this out, hey, we gave one person a 600 today. One. And it was great. Also, if you guys want to know where these questions are, go to nurseslabs.com. And now, since we're done with these questions, we are going to do some FaceTime. All right. We're going to do some FaceTime. So shout out to y'all. What's going on? I know everybody done left, right? So for everybody that doesn't know who I am, or now you can kind of put a face to the whatever. I'm Kevin. I go by the boot nurse. Shout out to all y'all. Shout out to 93 of y'all that's going to be that, whoever is going to rock in here with me. So I want to know who you are, where you're from, where you're at in your nursing journey, and what questions do you have about anything. So, and especially in regards to nursing. So what questions do you have? Lexi, I see you. What part of Texas are you from? I live in San Antonio. San Antonio. Somebody else was saying something about going to Galen. I actually looked at that school, hey, maybe I could get a job there. So going into my second year, shout out to UT. East Texas. What's over in East Texas? Like Texarkana type? Well, is nursing worth it anymore? Isaiah, it depends on what you want to do in nursing. You're in Austin? Oh, no. Okay. Isaiah, it depends. It depends on what you want to do and what your dream is and what your thoughts are. Like, what type of nurse do you want to be? Michaela, yeah, you're from Oklahoma. I already know that. Boomer sooner ill. I'm 18. I live in PA. I'm a freshman in classes looking to be a travel nurse. Well, ma'am, you're 18 years old, living in Pennsylvania, and you're a freshman in school. My total recommendation to you is you need at least a minimum, and I mean a bare minimum of 1 year of working as a nurse before you decide that you want to go and do anybody's travel contract, because they will throw you to the wolves. Trust and believe me when I tell you that. Baton Rouge, Louisiana. Okay. 4 semester BSN program. Okay. Shout out to you, Martin. Shout out to you, KJ Martin. Isaiah, ER. Oh, so Isaiah, you want to be an ER nurse. Okay. It depends. It really just depends. You're interested in PACU nursing. I worked in the PACU for a little bit when I left the ICU and I transitioned and waiting for the OR. I loved working in the PACU. I loved it. The schedule was easy. The patients were coming all out of the operating room. You had everybody and everyone that you need there. My mom is a family nurse practitioner. Shout out to your mom. Right. But if that's the route that you want to go, cool. You could do that too. Man, you got the whole United States in here. I don't know about all that. I got 69 people in here. There are 330 million people in the United States. Get them all in here so we can break TikTok. I'm a pharm tech, just interested in what kind of stuff y'all learn. That's what we learn, right? That's what we learn. I'm currently a CNA and want to ultimately be a pediatric endocrinologist. Oh, that is deep right there. That is deep. My goal is, he says, it's you, but I got hired in the cardiac step down. That's a good spot to be, because if you want to go to the trauma surgical ICU, get your basics down. There's nothing wrong with that. You had like 300 people in there earlier. Lexi, I think on Monday, I had like 500, almost 600 people in here. So some people come in here and they're just like, oh, he's just doing questions or it's just whatever. I think we had like 500 people in here consistently for like half an hour. And I was like, holy hell, I just need to pass the NCLEX. Hey, JC, speak it into existence and it shall be so. Okay, I'm all about words of affirmation. Don't tell me I just need to pass the NCLEX. Say, I will pass the NCLEX. Say it out loud. But they're not on, like, it's kind of like what Deion Sanders says. They're like, I believe. That's what you have to do. I just graduated my BSN, about to take the NCLEX. Thank you for your questions and help. Adriana, you are very welcome. Anyone in here in administration? God, I hope not, because half the motherfuckers I don't like. I'm just playing. Anyways, so what specialty do you do? Lexi, I work in the operating room. Wanted to pass my NCLEX on what? On your first try? Trust me, we all do. ER times 23 years. Shout out to you, Whip Rash. I love your content to help with being a preceptor. I love being a preceptor. Loved it. I'm 19, graduating in December, and I'm so scared. Scared of what, Avery? What'd I tell you? If you're scared, what, Avery? You've been here long enough to know what I say when I say that. I take it tomorrow. I'm so nervous. Hey, if you take it tomorrow, I don't even know why you're here, Jay. I don't know why you're here. No, for real. Confidence is everything. It is about confidence, but it's also about being realistic. If you've been studying correctly and studying right, some people don't know how, but if you've been studying, if you don't know it by now, you don't know it at all. That's facts. You don't know what you don't know, but so you got to go in there and apply what you do know and what everybody else knows, right? I applied for the spring program and I'm nervous that I won't get in. Okay. And if you don't get in, then what? You better apply somewhere else. Who's that to? That's to D. Hey, don't ever come into this chat. I'm being completely honest. Don't ever come in here with a problem without and not bring a solution. I'm scared and I'm not going to get in. Okay. So why only apply at 1? Why didn't you apply at 8? I applied at like 8 or 10 schools and like 5 of them got back to me and told me I got accepted. And then I narrowed it down to 3. And then of course I chose 1. You see what I'm saying? How many years of ICU experience do you have to have before you can go into the PACU? You can go straight into the PACU. They would rather you have, there was the pause, my bad. But they would rather you have some type of critical care experience because you are dealing with acute patients, especially respiratory, when they're coming from the operating room off anesthesia. So it is required. But I can tell you there's like there were probably like anywhere from like 3 to 5 nurses that were brand new nurses that came straight in to freaking, to the PACU when I was there. Hold up. What's wrong with admin? Dash ain't nothing wrong with admin. Anyways, so considering med surg, want to be well rounded before specializing, might consider clinical education. Cool, Martin. If that's what you want to do, cool. Like I said, I did ICU first, did that for a little over a year. Then I did PACU for a couple of months, and then I've been in OR ever since. So I've been in OR for a year and a half. I already had a little bit of OR experience because I was a surge tech for a while, so it really helped out just for me being familiar. Thank you, Edith, for the share. It's a scary world out here. It's a scary world out there. Okay, Avery, it is a scary world out here. So the best thing for you to do is to be prepared for it. So, hey, who remembers what I said on Wednesday, right? Avery, you're on the beach. So what are you going to do? You're going to stay there or are you going to get off of it? Covered wound care yesterday, was thinking about specializing because it was very interesting to me. Wound care is actually great. If you know a lot about wound care, it works out. I have ICU clinicals tomorrow. So I'm going to head out. See you soon. All right, Avery. Hey, remember, get off the beach. Get off the beach, Avery. Get off the beach. What does this say? You get to make your own treatment plans to treat patients. What? I don't know who that's to. What do you think is the best study for NCLEX? Wait, what do you think is best to study for NCLEX state boards? So it all just depends on you. There are so many. There are a lot of programs that are out there that are proven to work. Kaplan, Hearst, Remar, Mark Klimic, Picmonic, Simple Nursing, Nursing.com. What's some other good ones that are out there? Archer, Remar, not Remar, but UWorld. Mine. Go check it out. Links in the bio. But it all just depends on you. Did you do questions already? I did. We did questions already. We did 25 and we did them from fundamentals. We did 25 from fundamentals. So who is this? This is Gotta Love. I'm just going to say Gotta Love. So for you, ma'am, it all just depends on you. Like, what do you need? Do you need content? Do you need questions? Do you understand your content? Right? Do you understand how to apply content to NCLEX style questions? Do you need to practice doing the questions? Like overall, like what do you need? A question bank? Some people just need question banks. Some people need content videos. Some people read the book. Some people listen to audios and they retain it. Like, what type of learner are you? Like, it's not just about what's a good review, because the reviews are good. They're proven to work. But what type of learner are you, and how can you retain the information and for better for you to study? Okay. I did better with Archer, but I used all the questions on Archer. Do you suggest using something different? I don't know. I thought Archer's questions were good. And if you've already went through all the questions, Brandon, I know we talked a little bit about this, but have you taken your exam yet? When will you do live again to do more questions? Monday. Yeah, I'm planning to do home hospice right out of school and then get into wound care. Shout out to you. Question bank. I think I want to do home health too. Not sure though. Barely my second semester. Okay. Well, hey, it's good to project out, but hey, next step is school. Next step, semesters, school. One thing at a time. You can project it out, but one thing at a time. But I can tell you right now, if you want to do home health and you want to try to do case management type stuff, you got to have nursing experience to do that. Do I offer tutoring? I do offer tutoring. Go to go to thebootnurse.com and click the tab where it says NCLEX Coaching and Mentoring, and it is available there. Appreciate the share, Martin. Appreciate the share. I have trouble with critical thinking. A lot of people do have the trouble with critical thinking. The biggest thing is understanding the trends and how the trends work. Shout out to you, JC, for the lightning bolt. I don't know. I wish I had like a Thor hammer so I could just bow up in here, but I can't. So, okay, Brandon. So you haven't taken it yet. Why haven't you taken it yet? I can't remember exactly why. Tell me why. Shout out to all. I'm trying to catch up on all the questions you guys are asking a lot. Shout out to 48 of y'all. I appreciate y'all still rocking with me. Today is Friday. Your boy has military drill tomorrow. So I'm going to be in a whole nice military uniform, being a weekend warrior, doing my thing. So I definitely am appreciative for everybody that is here, as well as, whatever question you guys have. If you guys are new, welcome. My name is Kevin. I go by the Boot Nurse. Nurse Nelly is my co-host down there answering questions. We're both nurses. She does case management. I am an OR nurse, and future master degree holder in education. So that's how we do that. So, yeah. What questions do you guys have? I want to know who you are, where you're from, where you're at in your nursing journey. Let us know what's up. Let us know what's up. I know Lexi has been the question king up in here today, or queen. I'm sorry. The question queen up in here today. So, Do you like OR? Combination of amount of time I've been in the OR has been 14 and a half years. The OR is cool. It can get old just like everything else. That's another reason why why I went to the ICU first. But then I went back to the operating room because I enjoy the surgical realm. I love the surgical realm. I love watching surgeries. I specifically worked in, I did general surgery and I did GYN and I worked with the Da Vinci robots. So if anybody wants to know what the Da Vinci robot looks like, just go, you look at it on YouTube and see how it works. So do you get bored? It can get boring. But it depends on what surgical case you have going on. And then for the most part, you want surgery to be boring, because if it's not boring, some shit is going wrong. And then you're just like, whoa, right? So it can get boring. It can very much get boring. I'm just keeping it all the way real. So it can very much get boring. What else you got? Grad nurses should work med surg for the first 2 years. That's your opinion. That is your opinion. As a new grad, I didn't work. I didn't go to med surg. I went straight to the ICU. So that's your opinion. Nurse Nelly will agree with you that she believes that all new grads should go to med surg. However, you don't have to. Like one guy that I'm mentoring and I'm coaching right now, he just got into a cardiovascular ICU. He wants to straight do not pass go, do not collect $200, and he wants to go to the ICU because he wants to go to CRNA school, and he wants to do flight. You know what? And then he eventually wants to go to CRNA school. So why stop yourself from going there if the opportunity presents itself just so you can go to med surg? You can go to ICU, but not all new grads have to do that. You know what I'm saying? Like my first experience in the ICU in the burn center was phenomenal. Like I had great training. And then when I went out to a medical and a neural ICU, that's a totally different story. But then I realized where my true passion was, and it was here, and not here on TikTok, but it was teaching people, because I've already been an instructor for a long time. I taught in the surgical technology program for 3.5 years. I taught other programs. I was a BLS instructor, ACLS instructor, advanced burn, pre-hospital trauma, and a tactical combat casualty care instructor. And I'm also a trauma nurse instructor. So I've been teaching for a long time. And that's where my passion and my love is teaching other people. And as a preceptor, I love precepting students too. So if you know what you want to specialize in, then should you? Yeah. If you know where if you want to go to labor and delivery, go straight to labor and delivery. What's stopping you? Not all new grads, but I had a bad experience with new grads in ICU and with a shitty foundation. Yep, I agree. Few all caught up. All right. I don't want to break my body with bedside, no kids yet, but hopefully I'll work and have a good work-life balance. Lexi, so here's the one thing I'll tell you is that when you are working bedside, you'll feel it. And I'm pretty sure you already feel it now, but it's you're going to go through your imposter syndrome. You're going to go through your imposter syndrome your first 6 months to a year, like really hard. And 2-3, in my opinion, 2-3 years of nursing, at that point, you should kind of figure out where you need to pivot, where you need to go. Like, do you want to go for your master's degree? Do you want to go for your MP? Do you want to do CRNA school? Do you want to switch from being in one unit to another? Do you want to go to home health? Do you want to do aesthetics? Do you want to do something that's not nursing related and go into a non-traditional nursing job, but you can still use your nursing license, because there's so many other places out here that love nurses? You know what I'm saying? So in my opinion, by the 3-year mark, you got to pivot. You got to pivot, right? Nurse Nelly pivot. She pivoted and now does home health, loving it. So she had her fair share of experience doing bedside, the good, the bad, the ugly. Me, I went from a burn ICU to neuro and medical ICU during the second wave of COVID to PACU to the OR, so it happens. Let's see. No, I mean, why should you med surg if you know you want to do something else? So a lot of people want people to go to med surg first. This is for Dana. A lot of people want people to go to med surg first. And I don't disagree. I don't disagree with it, because they want you to get the nursing foundations, and med surg is where you get that. But you can also get the nursing foundations also in ICU or in the ER. It's just at a faster pace, and some people don't pick up as fast as other people, CRNA school is rough, but the autonomy is worth it. It depends on what you want to do, Maria. Like I wanted to go to CRNA school, but then I realized that my love and my passion for CRNA school it was a dream while I was in the military. And then when I got off of the dream of in the military, it was just like, no, like I don't want that for myself anymore, and that's okay. JC said, I didn't learn much during my med surg clinicals. I learned so much in the trauma surgical ICU during my capstone. That's good. At least you learned something, right? Tommy said, reassure me that getting out of my non-accredited program is worth it if for an accredited. Yeah, absolutely. Because you want to know what's crazy about a non-accredited program, Tommy? The board of nursing could just be like, no. You could get through that whole fucking program. And then the board of nursing will be like, no, you can't take it. You see what I'm saying? You need to get out of that and you need to get to an accredited program. What did you say? Let me read it. It says, reassure me. I'm going to reassure you. Get that ass out of that program and go to an accredited program because no, you don't want that. Maria said, what do you think about for medical assistants going into the LVN program? Go to it. Do it. I'm all about people doing their things like that. If you move out of state, you're establishing, is it hard to transfer your license? No, Lexi, it's not. There's a thing that's called the Nursing Licensure Compact. And essentially what it allows for you to do is travel from state to state using your same license. There's only a few states that are not part of it. I can't think of all of them off the top of my head, except for like 3 or 4, which would be California, Oregon, Washington, and I think Montana. The other there's 44 states that are part of the NLC, as we call it. And you can work in one state and then go work at another state or work in another state. So if you wanted to travel, be a travel nurse, it's very helpful. But if you wanted to move to a different state to live, you have, I believe, up to 60 days to transfer your license from the state that you were in to the current state that you live in, if that makes sense. People make too big of a deal of being in med surg first. You'll learn no matter what. 100%. I agree. Why are you in a non-accredited program? Thank you, Maria. You're welcome. Bowler said, since you're a nurse, I am a nurse. What are your recommendations on occupational therapy versus rad health? Was it radiation or X-ray tech or sonographer? Depends. Honestly, it just depends on what you want. Like if occupational therapy is exactly what it is. It's occupational. Like, you're working with, I think sometimes you work with kids and all this other stuff. I don't know the exact details into occupational therapy, but X-ray tech and sonographer, you're doing X-rays, images. You can actually get more, what's the word I'm looking for? You can get more, not accreditation, but more certificates by doing X-ray, and you can go all the way up to be an MRI tech. And MRI techs, like those, they make some money. And I don't know if you guys know this, but you can actually be a certified radiological nurse. Like you could be a certified X-ray nurse. You can be a nurse working in X-ray. I'll bet y'all didn't know that, right? Not on any BP meds and unstable. I don't know what we're talking about. What we miss? Cassie said, I'll definitely use your program once I start my LPN program on September 26th because I need to pass. Cassie, you already know we about it. We got you because they didn't understand that it could bring down BP further and don't monitor values after. What are we talking about? Hello, just wanted to ask, is peds a good specialty to go into? I don't know. I mean, it's a specialty that's available in the hospital and in nursing, but it depends on you, Jocelyn. Do you want to be a pediatric nurse? I know that Kevin don't want to be he don't want to be a pediatric nurse. He didn't want to be anything with peds except for like newborn. Like I liked newborn. Like there's something about babies that are being born like 20 minutes ago that are just looking at you with all their youth and just lovely, just like there's something about being in a newborn nursery that I love so much. It allows for you to be gentle. And I liked it when I was there for sure. What's up, y'all? Hey, Boot Nurse. What's up, Thunder? Thunder, you late. Why having a good foundation is important because jumping to specialties, they lack so much. Okay, I got you. You're so funny, bro. Like for real. Go get your MSN, be an instructor, but you're funny. You can relate and be real. That's honest. And here's the thing. I don't need to have an MSN to teach. All right. However, I do have to have my MSN to teach RNs. As a BSN nurse, I can teach LVNs, but that's on a academic and formal level. We can teach and learn from each other. And that's what people get. It always becomes like a dick measuring contest. And it's stupid. And I never understood that. Like, I'm an ICU nurse. I'm better than you. Nurse Nelly will tell you how they get. Nurse Nelly will tell you how they will get. I'm telling you right now, like, we can all benefit from one another. Well, at this one of the schools I'm going to right now, they won't let you. They won't let you teach any, like, they won't let you teach the RNs, the ADN RNs or anything like that. So, what nursing department is your favorite? Or are you in? I liked PACU, but I work in the OR. That's just because you want like 100 kids. Ma'am, I do not want 100 kids. You of all people know that. Oh my God, didn't know. I just based that off of my instructor. Yep. So you don't have to have your master's. So there's LVNs that are out here, LPNs that are out here that you could teach, but we always teach each other. ICU nurses are mean girls. I don't give a fuck what your specialty is, bro. just take care of just take care of you, take care of your patients. Don't be an asshole. I couldn't even teach BSN clinicals without being a doctoral or master program. Maria, so it all just depends. So like, I can tell you right now, and I don't know exactly what institute that you work at, but they are hurting, at least here in Texas, they are hurting for instructors, especially at the faculty level, right? So I had asked and reached out and they were just like, hey, yeah, like if you want to teach in the LVN program, you can. And that's on the formal academia level, right? But I see ADN nurses all the time and I'm just like, why can't I teach them? Why can't I teach? It's not hard for me to teach them, but it's just like, oh, I could teach them in clinicals, but I can't teach them on the podium. Or I can't teach them in checkoffs and simulation lab. And I'm just like, oh, so the fact that I have a 4-year degree means I can't teach something to a 2-year degree nurse? I'm like, whose idea is that? And that's the problem, is because now it's segregated to the point is like you have all these people that are qualified at the BSN level that could teach ADN level, but they just don't want you to do it, which I think is stupid. So Lexi said, I hear doctors have a God complex and don't really want to help. Is it true with your experience? It depends on the doctor. But yes, for the most part, doctors do have a God complex. And sometimes you as the nurse will have to learn how to stick up for yourself. And you will really have to put them in their place. And you have to do the same thing with other nurses. Like you can't allow people to bully you and run over you. Like if you fuck up, you got to man up or woman up for that. Like you got to be like, hey, yo, that's my bad. I take that L. Like if you forgot to do something. Like me, I've forgotten many things, right? Nothing that's critical, right? But I've forgotten many things. Like one time, I was so busy during the day, I forgot to do a vanc trough, like for vancomycin, right? So we want to know how much vanc is being pushed into the patient because it has a narrow therapeutic window, right? And so the pharmacist came around, and it's actually funny because me and the pharmacist are friends. We're cool now. And so she came around and she got mad at me because I didn't send a vanc trough for that patient. Because then next, he started having, ototoxicity, and because it can cause, ototoxicity, nephrotoxicity, right? So we don't want to mess those. We don't want to mess up the liver. We don't want to mess up the kidneys. We don't want to mess up nothing like that by giving vancomycin, right? Exactly. So why make it so hard for you? I agree 100%. Great docs for real. My instructor's on the verge of retiring. No hate, but they're begging for more instructors in in the Houston area. Yep. Because we have a Galen here in San Antonio and they say the same exact thing. I work with 7 doctors and they're great. So I could tell you right now in the general surgery realm where I work with doctors, the majority of them, besides maybe one of them, are great. They're all very particular and for good reason, because in the operating room, you have somebody who willingly signed a piece of paper that will allow for you to cut them open. So their barrier to protect themselves is gone at this point. So now infection and essentially, systematic approaches. And you have to know how each doctor works, because some of those doctors have been doing stuff longer than, I'll just say for you, Lexi, I don't know how old you are. We'll use Avery as an example because she's 19, longer than she's been alive. Right. So some doctors are assholes. Some doctors in my opinion, don't need to practice anymore. They need to go away. That's just my opinion. My opinion, of course. And some doctors think that, they could talk to you however they want, like they don't have to leave the hospital and they won't get beat the fuck up. I'm not going to beat them. I'm not going to beat them up, but they literally just think they could talk to whoever however the fuck they want. I'm not your friend. I'm not your wife. I'm not wife. I'll be somebody's wife. Doesn't matter, but I'm not your friend. I'm not your wife. I'm not your husband, not your boyfriend, not nothing. I was like, I'm a nurse. I'm here to work with you. We're here to be as a team. You're not going to talk to me like you lost your fucking mind. And I've told one doctor that. And I was just like, sorry, bro. I don't know what you want me to do. I was like, unless it involves the safety of this patient, I'm going to need for you not to talk to me. I had to go talk to the director after that, but it's cool. I fought my case and I don't care. I'll keep it all the way real. So what are your thoughts about new grads going straight to the ER? Do you think it's a good idea? If that's where you want to go, Sharonda. Hey, Sharonda. Okay. But yeah, so you're very articulate. Fight for your right to teach. Students need you. Also, I'm 22. Okay, yeah. So yeah, he most definitely has been a doctor longer than you've been alive, Lexi. So, but yeah, shout out to all y'all. Shout out to 31 of y'all that are rocking with me. I appreciate the 26,000 likes. But with that being said, I've been on here for what? Since 5:30, 2.5 hours, 2.5 hours, like on the dot. You know what, Lexi? How long do you have to be a nurse before you can do contract? My suggestion to you is that at the bare minimum, and I'm saying this with so much just at the bare minimum, you want a year. But I would recommend you be a nurse working in a hospital for 2 years before you travel. Lexi, I want you to pick the next subject. Yes, time for wine and charting. There you go. Lexi, I want you to pick a subject. Since you're the queen of questions today and you hung around to the end. So I want you to pick a subject. And then I will determine on whether or not I will like it or not. So shout out to y'all. Yes, Lexi, where do you want to go over? Let's do it. Come on, Lexi. You want to go over management of care questions? You want to go, I'm a new grad starting in the ED. Shout out to you, Tor. Is that for like Tori? Love this live. What's up, Martin? Martin, you still here? All right, cool. All right. Hey, I think you're gonna like the ER. You're gonna like the ER a lot. It get wild up in there. Let me tell you. Victoria, yes. Oh, I got you. Something with health assessment. You know what? I'll look into that. We'll look into something health assessment, or I'll find something relatively close to health assessment. They took out our book. We can only use ATI to study. Okay, tracking. I got you. So we will look for a set of questions in the health assessment realm. Wow, 21,000 likes. Go, coach, go. Look, 29,000. I only got 26.5 right here. And I'm telling you, the last live, I got like 50,000 likes. So heart and lymphatics. You want to talk about cardiac? We can talk about cardiac. I think I can find some cardiac stuff. So, all right. So you've given me 3. I'll pick from those 3. We'll figure that out. We'll pick for that 3 and we'll figure that out. But anyways, I appreciate everybody for being here. Here's my little shameless plug. If you need NCLEX help or anything like that, check out the 7-day NCLEX course. That link is in my bio. It's for $48. Once you get it, it is yours forever. You get all the updates. There's NCLEX questions that are going to be put in there. There's new generation NCLEX videos that are going to be put in there showing you how to break the questions down like I did on here. I'm coming out with a cheat sheet. So everybody that gets into the program now, I'm going to send a cheat sheet out here in the near future. Pretty much the ways to kind of help you. If you know somebody that needs it, or if you're going to be graduating here in the next 6 months, a year to another, to 2 years, and you want to have a jump on it or just to have it, I'm just saying it's there for you. Check it out. $48, right? Also, I always like to say these things. It's just like, get off the beach. So whatever you feel like you're struggling in, you know what I'm saying? There's only two people that stay on a beach. It's somebody who's going to die or somebody who is already dead. And that is something that I got from Saving Private Ryan. Is if anybody's ever seen that movie, it's wild. And, depiction of Normandy and the invasion. So if you want to succeed, you got to push through the storm and you got to get off the beach. I'm telling you right now, you got to get off the beach. You got to do it. Remember, every one of y'all have a pen. Every one of y'all have a pen, right? It's up to you how you want to write your story. You want to sit there? You want to sit there and, stay on the beach to where you can't use this pen to write? Or do you want to get off the beach and then tell your memoirs? That's how we got all the stories from World War II. Majority of them, right? So anyways, I appreciate y'all. I love everybody up in here. I love all y'all. Make sure you guys check out my YouTube. Everything that you could Google me. That's weird to say, but you can Google me, The Boot Nurse. Check me out on Instagram. Of course, here on TikTok, Thread. What else? X. You know what I'm saying? But of course, I'm super active on Instagram. I want y'all to look at that. I want y'all to go over that. Army nurse girl, you late, but we always appreciate you having me here. All right. So I hope everybody has a good night. I hope everybody has a good and safe weekend, and I will see all of y'all on Monday. Bye.